This is the morning session that will run into the afternoon for the Joint Standing Committee on Health and Human Services. We'll be hearing about 13 bills today that we'll be working on, trying to get them ready to vote on. There are no changes to the order, except that 11:48 will be moved to right after 1:18. And I'll come back to that list in a minute. If you'd like to watch us as well as listen, you can go to maine.gov, legislature.maine.gov, and look for the Health and Human Services website. There you will find a link to our YouTube page. Everything today is recorded and has been recorded as we've been meeting, so you can go back and look at old sessions if you'd like to. Reminder to anybody that we invite into the conversation that we anticipate some technical glitches. We haven't been disappointed yet. Bear with us as we work through those. They're a regular occurrence. My phone is off, and we're not using the chat except for moving the meeting along, not for any content. We'll go over the bills again in order that I implied. We'll start with 74, then we'll go to 118, 1148, 287, 910, and 873, and we'll pick up there. Somewhere along in there, there's a lunch break and maybe a mid-morning, later morning break. We'll see how it plays out. And also in the middle of the afternoon. So those of you who will be joining us in the on the attendee list, there's about 14 people there now. If you feel you have something particular to contribute to a conversation we're having, please put your hand up, and I will try and see that, keep track of that. And why don't we go around the virtual horseshoe and begin with Representative Zager.
Good morning. Thank you, Mr. Chair. My name is Sam Zager. I represent District 41 in Portland.
Representative Lemlin.
Thank you, Senator. Good morning, everyone. My name is Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Barron, Callis, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glumber, Levain, and Kenduskeag.
Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
Representative Meyer.
Good morning. Thank you, Mr. Chair, and welcome to all who have joined us here today. I am Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott, where I live, and parts of Kittery and South Berwick.
And I'm Ned Claxton. I'm honored to represent the folks in Auburn, Minot, Mechanic Falls, Poland, and New Gloucester, Senate District 20. You may notice that there are a number of committee members who are not present. They are usually tied to other committees, and with multiple other obligations, it's hard to be two places at once as we try and work through all the bills that we've been asked to review. Today's session will be supported to begin with, maybe all day, I'm not sure. Ms. Broom.
Hi, I'm Anna Broom. I'm one of the legislative analysts for this committee, although I'm with you all day today, and I work for the Nonpartisan Office of Policy and Legal Analysis.
And our clerk, Carrie Withy.
Good morning. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
Anything to be dealt with before we get started with bill number 74? I don't see anything, so we'll turn it over to Anna to present the analysis.
Okay, so I just have to find which screen I'm looking at here. This one. Well, that's the wrong one. Let's try that again, shall we? Sorry. You're looking at the next bill instead of the last one. I'm sorry. Let's try that again. Okay. There. Oh, it's all right. Are you looking at LD 74 now? Do I finally have the right one up? Okay.
Yeah.
So you have already had a work session on this. This is the bill that increases the personal needs allowance for people who live in nursing facilities and PNMIs. So after the last work session, you had some questions, and here is what I have for you. So you asked for the fiscal impact for the nursing facility increasing the PNA from $40 to $50, and you can see the annual impact there of $522,610 of general fund. I think my commas are a little, oh no, I'm sorry. The general fund is $189,760. Then the PNMI, an annual impact, what the impact from 50 to 70 would be. And you can see there that is broken down for you there as well. Then you also had questions about including the facilities for the intellectually disabled. So you can see that the department went ahead and included that above. Then you also were talking about the possibility of having an impact of a COLA increase each year. And so you can see there that a 1.92% average annual increase over the last 4 years. So that would obviously increase those costs by both state and federal amounts. But apparently there may be also an additional system cost to implementing an annual increase due to the COLA, and we don't know what that would be yet. And then, I wasn't quite sure what you were looking for in terms of the intellectual disability inclusion. So what we have included is the ICF IIDs. These are the facilities, the institutions, the long-term care institutions, they're section 50, and they can be included either as a nursing facility or residential care, which is why they've included those in there. And they've said we wouldn't need any additional language. What it doesn't include is group homes. So there was a question about whether that would include like the section 21 group homes, but they're funded in an entirely different way. So a personal needs allowance isn't relevant. So this was something that Representative Craven had specifically requested. So my understanding is that the information that we've been able to provide is sufficient. So if you need further information about the group homes, that would require a different kind of drafting entirely, because they're not, their income is different. So hopefully that helps. Just as a reminder that this was originally drafted for nursing facilities to go from 40 to 70 and residential care from 70 to 100. That's actually incorrectly drafted, the PNMI issue. But what you did ask for was nursing facilities from 40 to 50 and residential care from 50 to 70. So that's what we've included, plus the ICF IIDs.
Are there any questions of Anna? Does that prompt any comment from anybody? Yes, Representative Craven.
Thank you, Mr. Chair. Yes, I think that, thank you very much, Anna, for doing that research for the community. And I will, I think that it's a bit too cumbersome to include in this particular legislation. So I won't be pursuing that piece. Thank you.
You're specifying the homes, are you, Representative Craven?
Yes.
Okay, thank you for that clarification. Any other questions or comments? Is your hand still up, or do you have another comment, Representative Craven? There we go. I don't see any other comments. So it seems to me, before we go further in the conversation, we've been joined by Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Boothbay Harbor, South Port Edgecombe, West Port Island, and part of South Bristol. Thank you.
So looking for any feedback about the different allowances and the inclusion of the IDD community in that is not a problem, as I understand it. So are folks comfortable with increasing for nursing facilities to $50 and for PMIs to $70? I'm seeing some head nods and okay. And then the other issue, as I understand it, would be the COLA, the cost of living adjustment. How are folks feeling about that? Yes, Representative Craven.
Just playing with my little hand, sorry.
Okay, practice. Yes, Representative Zager.
Thank you, Mr. Chair. I'm in favor of the cost of living increases because it seems like it would just put things on a better glide slope. So a bill like this wouldn't be as needed, or at least maybe not as needed as on a shorter interval as otherwise.
As short an interval, and as I remember, the last time this rate was changed was a few decades ago. So I may be wrong about that. Representative Perry.
I would like to move LD 74 as amended with the COLA added, and of course the fiscal note as it comes.
Okay, there's been a motion.
I second.
And a second, and that would allow for the $50 allowance in nursing facilities and the $70 allowance in PNMIs, inclusive of the IDD community. And it would include a COLA. And I guess the government has a standard CPI they use, or?
I believe so. I will find out from the department exactly how that's worded, because there are a number of different ones, but that's just something that we would draft with the department.
For the purpose of this motion, we anticipate using the department's CPI.
Whatever is most appropriate in the circumstances.
Yeah. Okay, so there's a motion on the floor. It's been seconded. Is there any additional discussion? Then I guess it's to you, Ms. Withy, for the vote.
Representative Zager.
Yes.
Representative Zager. Yes. Representative Lemlin.
Yes.
Representative Lemlin. Yes. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry. Yes. Representative Griffin.
Yes.
Representative Griffin. Yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven. Yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore. Yes. Representative Meyer.
Yes.
Representative Meyer. Yes. Senator Claxton.
Yes.
Senator Claxton. Yes. That's 9 yes, 4 absent.
Thank you. So that brings us to LD 118.
All right. So you may need sponsors, Senator, Representative, I'll try this again, Molly, and also Director Landry have all been involved in this one. So we'll see if how this goes. So this is a complete strike and replace. If you remember, you had this conversation. This is the bill that relates to the children that are stuck in hospitals waiting behavioral health services. And at the last work session you had, we talked a lot about the annual report that the department does and what could be included in the annual report, also standardizing the data from the hospitals. And there was also some conversation about stakeholder groups. So let me show you where we're up to. This is still somewhat of a little bit of a work in progress. So I worked with the department and with the sponsor. I don't know if there is full agreement on this yet or not, but this is where we're up to. So I want to draw this is the existing law for, or a markup of some of the existing law of the children's mental health section that is in Title 34B. So the issue that we ran into is that there are a lot of reporting requirements in this section that aren't currently, that we don't receive, and the annual report that we wanted to include this in is not included in statute. They do it out of the goodness of their heart. So that made it difficult to figure out how to require it to be in an annual report when the annual report wasn't required in statute. So what we thought could work was to fix the statutory requirements for reporting, and that way there would be sort of a sync up between what the department are doing that is, helpful to you, and that way there would be a way to include what Representative McCreight is looking for. So here's what we did. So, or at least what we have at the moment. So this is subsection 9. This, just as a reminder, it's in the children's mental health section, which I can bring up again if you would like. So the current requirement requires this August 1st report that relates to, funding. You can see this blended, pooled and flexible funding. Then the experience of the department in coordinating administration, the barriers to improved delivery of care, which is something that people are interested in. So the proposal at the moment is to fix this reporting to reflect what they are doing right now, or at least what they were doing in the last year or so, and then include this paragraph D, which is the number of children served by crisis providers and the number of children awaiting the appropriate level of behavioural health treatment in a hospital emergency room for the preceding year. The department shall make reasonable effort to obtain information from providers, including implementing a standardised system for the reporting of data, and then the confidentiality piece put on the end there. I don't know if that triggers public records exception, but we'll cross that bridge when we come to it. And then there's this other section in here that requires this monthly reporting since 2001 on Children's Crisis Service. We don't get that. We've never seen that, or at least not since I've been here. So that's not something anybody does. So it makes sense to get rid of that. And you can also see that this up here at the top of paragraph D says the number of children served by crisis providers. That wasn't part of what Representative McCreight was looking for. That's reflecting this striking out of subsection 10. Then you can see this is unallocated language. This was the conversation about standardizing the data that you heard about from the hospitals so that there would be apples to apples. So, and that also, if you can remember back to this very long work session a couple of weeks ago, also required, was conversation from the committee of having an interim report on how that's going. So this is the proposal at the moment, to have this standardized data that the department will work with the hospitals to develop a consistent and reliable system of data definitions and data collection to identify the number of children with behavioural needs who remain in hospital emergency rooms after they no longer need a medical hospital level of care. This is a reference to the paragraph D. The data must include the length of stay in hospitals beyond, it was originally 24 hours. The department, and I believe Representative McCreight, have agreed that it's 48 hours. That's related to how they actually collect the data. You'll have to ask Todd Landry about the 48 hours because that's out of my wheelhouse. But the length of stay beyond 48 hours, and the reasons for the extended stay, including but not limited to the lack of appropriate hospital or residential bed or lack of community services. That was the sort of the point of this. And then the department would provide a report to the Joint Standing Committee, this committee, that shouldn't say January 31st, 2021. I believe that's actually supposed to be July. I'm not quite sure what happened there. That's a mistake on my part. So the thought was there would be this interim report that would come to you about the standardization of data, and then there would be this annual report that would come to you that would give you the actual data. There are still some little pieces hanging out there that I'm not entirely sure where they've landed. And, you know, I ran out of time to work on this. So there may also be some conversation about where or how a stakeholder group fits into this, but that will be up to the committee and whoever you want to hear from. So I'm happy to explain any of that when you need it, but that's the proposal that we have. So.
Thank you. I notice we've been joined by Senator Baldacci. Would you introduce yourself, please?
Thank you, Mr. Chairman. I'm Joe Baldacci. I represent Senate District 9, which is the city of Bangor and the town of Herman. Thank you very much.
So let's start with committee. Does that analysis from Anna prompt any questions, raise any issues that you'd want to bring up right now? Okay. So then I think we should go to the sponsor. Welcome, Representative McCray, and get your feedback about what you've just heard from our analyst.
Thank you, Mr. Chair, and thank you, Anna. Wonderful as always, but you knew that. Yeah, this has been a lot of negotiation in the best sense, you know, back and forth discussion about what is going to work. I feel really good about the department developing a standardized form. I think that's really important, and I really appreciate that. I appreciate that the data collection, as we all know, needs to be confidential, but that there will be report back to see how it's going. You know, hopefully we'll see improvement. What I did express some concern about the piece that says reasonable effort on the department's part to address this. The feedback was, the reason for that wording was we can't require hospitals to report, but we can set up the system for that to happen. So I leave that to you and the committee who know more about this, how this functions. I just want to make sure that there's good communication. We know there's a problem. What are we going to do about it? I think we're in a really good place here. My concern is, as Anna ended with the stakeholder piece, my understanding, it was requested by the department and by the Children's Cabinet that this fall under the Office of Children and Family Services. And the reasoning for that was because a lot of the list I had of who should be at the table is at the table. But I want to make sure that we have the providers at the table in whatever fashion makes the most sense. If it's folding that into what the Office of Children and Family Services is doing, whatever that would look like, but they need to be at the table as this process is going on. I really like this idea of identifying that we're looking for the barriers. We're looking for what needs to be done. It doesn't specify that there will be a plan. I think the original pieces of the original bill would stay, the definitions piece, and that the committee would get report backs as Anna described, and that the department could report out further action depending on what happens within this period. I like the idea of an interim report. I know it wouldn't be the same as an annual report, but I think Senator Claxton, you had highlighted that. And I think that could include what's the standardized form and where are we so far and how are you going to involve the providers, maybe would be the meat of that. So I think we're practically there. It's quite different than this bill started out last session, but that's how it goes. And it's a process of everybody having input and working together, which I appreciate.
So before I go to Anna for some additional clarification, it sounds to me that with the resolution of the issue about getting the right people to the table, you're pretty comfortable with where we are with this draft.
Yes.
Okay, all right. And Ms. Brum, you had a comment about or feedback about language from the original bill?
I didn't think that we needed the definitions. I'm going to bring up the language again that we have. So go up a bit. Sorry. So I mean this is about children. I mean, the definitions that we had were behavioral health needs. I mean, this is in the children's mental health section. So I think the whole section is about behavioral health needs. But right here in the standardized data, it's like include the length of stay in hospital beyond 48 hours. Originally, we had an extended stay definition. And then we don't really need to define a hospital emergency department. So I'm not sure we need definitions because we're putting this in existing law. I mean, we already know who it applies to because that is an existing law. And I know Representative McCreight is looking for definitions, but it isn't clear to me why they're necessary given that you're requiring this standardized data and putting it in an existing law. So, you know, the appropriate level of behavioral health treatment. I mean, I think that's reasonably clear what that means. But if the department and the sponsor don't agree, then obviously we can go ahead and put definitions in there, but they have to be in this paragraph D in order for, in other words, if there's something in paragraph D that needs to be defined in statute, then we can do that. We have to have a definition that has an actual purpose. If you want behavioral health treatment to be defined, I guess we can do that, but we use the terms behavioral health and mental health all through the statute. And I know this is a particular thing for Representative McCreight as well. And she knows far more about it than I do.
Okay. Any comments so far from the committee in response to what we just heard? Then it seems like we should invite Director Landry to get a sense of how you are with where things stand right now.
Thank you, Senator Claxton. And for the record, I'm Todd Landry, Director of the Office of Child and Family Services within the Department of Health and Human Services. My thanks to Anna, to Representative McCreight, and others who have worked with us on the drafting so far. I really, we're comfortable with what Anna has presented in the proposed amendment. We're comfortable with the reporting requirement. As she indicated, we've been doing this for the last 2 years and have every intention of continuing to do so. And this formalizes that. So we don't have any issues or concerns with that piece of it. We also I don't believe that we need any further definitional requirement. I think there is an understanding of appropriate level of behavioral health treatment, generally understood to be treatment as identified through an assessment performed by a professional is generally the working definition I think that we would be working from, and that's generally understood. About the only question I would have is in section 3. On the date, this bill currently, to my knowledge, does not have an emergency provision. So I understand it would be, adopted in July or 90 days after the end of the session. And so having an interim report, potentially even before it goes into effect, seems a little bit contrary. And so I would suggest, if the committee was comfortable with it, of an interim report that would be that would coincide with the annual report, and that would be approximately 6 months after the close of the session, and that would give us appropriate time to work with everyone and actually have something to report back as it relates to this. From a working group perspective, in addition, notwithstanding what's in section 3 as far as a standardized data piece, from a working group perspective, what we would logically do is probably include this work under our crisis strategy work that we already have in place. I know on the crisis strategy work group, among others, including a number of community behavioral health providers, I know that long list here, St. Mary's, Acadia Spring Harbor, NMG, EMMC's Emergency Department, Maine General, Waldo County General, and 3 hospitals on the Mid-Coast have all been invited to participate in that work group. So I do think we have appropriate representation, and that, of course, doesn't include the list of individuals from a community behavioral health provision of service, including those crisis providers. So I think the bill captures the intent of the sponsor, and with the only question being at this point, the standardized data report back date, we're comfortable with the current draft. Thank you for the opportunity to weigh in.
Thank you, Dr. Landry. Are there any questions of Dr. Landry? I don't see any. Representative McCreight, did you want to chime in?
Thank you, Mr. Chair, and thank you, Dr. Landry. Yes, that's very helpful. I think including it with the work that's being done makes sense. It's highlighting this issue, but including it in the work you're doing. And hearing the list of who's involved makes me comfortable with what you're proposing. Up to the committee, obviously, about all of it, but about the dates, that's not a deal breaker for me. I just want you to have the information you need to make sure we're doing this.
Okay. Thank you. Are there other comments, other questions? Ms. Bogart, did you want to jump in as long as you're on the screen with us?
I'll just add a thanks, given the opportunity, to everybody who's worked on this.
Okay. All right. I noticed that Representative Madigan has joined us. Would you introduce yourself, please?
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
Thank you. Anna, do you feel like you have enough specifics to finish the draft process?
Right. I just have a couple of quick clarifications. So I think what I heard, and this makes sense, Dr. Landry, that you could make that it wouldn't be an interim report exactly, but that sort of one-time report could be January 1st, and you could just include it in that annual report. But that did remind me that I would like to put in a specific date as opposed to just the annual report. It makes it really hard to keep track of them. So if the department were okay with the January 1st date of every year for the annual report, we'd also put that in. But my understanding, just to repeat myself, is that that one-time report would be included in next year's annual report, but as a one-time thing. Does that make sense, right?
Speaking from the department's perspective, we'd be comfortable with both of those components, yes.
Okay, so that would be 22. And then I just want to make sure that we are not doing a stakeholder group. I've got distracted by the dates. There's no stakeholder group language now, correct?
That's the way I understand it.
Then I'm good to go. Thank you.
Okay, and I just wanted to clarify with you, Dr. Landry, that if the committee was to ask in April next year for an update on the report, that data is already being collected. Molly could get that for us if it was something we felt we needed. Yeah.
If there was any follow-up information that you're interested in receiving at any point in time, but specifically after our annual report is released, we'd be happy to provide that to you. Yes.
Okay, great. So that'll be part of the organizational standard operating procedure. Great. Senator Moore.
I guess, thank you, Senator Claxton. I guess I'm just such a visual person. There's been so many changes made to the last amendment that we looked at. Is there a way of that possibly getting a copy of the draft, Anna, that you were sharing with us today?
I just forwarded it to you.
Okay.
It was confidential prior to this, Senator, but I did just send it to you when you asked.
Thank you, because like I said, I'm just so that I have it in front of me to look at. Thank you very much.
Will that be adequate for voting for you this morning, Senator Moore? To get the cleaned up version? Okay, all right. And I see too that we're joined by Katie Harris. Did you have something material to contribute to our conversation, Ms. Harris?
Thank you very much, Senator and members of the committee. First, I'd like to thank Representative McCrate for her advocacy here. And I guess I obviously, you haven't seen the amendment, I haven't seen the amendment, but I just wanted to make sure that there was clarity that providers and other stakeholders are to be part of a planning process to address this very real problem of kids being stuck in emergency departments. I'm very concerned about moving the time frame from 24 to 48 hours, for example. We have a large number of children who get stuck. I think having them spend one night in the emergency department is problematic enough. And now moving that to 2 really represents a crisis in the system that takes up resources in the emergency department. It is the wrong milieu to be treating these children, and it really represents a problem. So I guess that would be one point I'd like to make. And I guess the second is that as the health system that has both sides, both the community-based services, it has the Spring Harbor Hospital inpatient beds, and it has the emergency departments. I can't emphasize enough how difficult these situations are. And I would hope that there be an expectation for the department that these issues get resolved, that we no longer have over 600 children waiting more than 24 hours in emergency departments in the coming year. So, so I see Dr. Landry is disagreeing with me. I appreciate that and would be happy to talk offline with him. I know this is a difficult situation for everyone, but we had asked for a plan because we fear that this crisis is getting worse. We're seeing it get worse in our emergency departments, and we would like very much to have a collaborative working relationship with the department to resolve, not on a one-off basis, but to develop a plan to support these children for the future. So with that, I thank you.
Wanting to avoid a debate during a work session, I'll turn to Ms. Bogart.
Thank you. I just wanted to recognize some of the conversation that we had with the sponsor in the interim, and that includes our commitment to including providers in the development of this data reporting system, as well as continue to include providers in the planning around crisis services. As Director Landry listed, a number of providers are already invited to be part of that conversation, and we both recognize that ourselves, that it's an important piece of that work, but also recognize the commitment of the committee and the legislature that they would like us to continue with that collaboration and expand it where appropriate. So I appreciate those the comments, and want to assure the committee that provider involvement has been and continues to be a commitment of the department.
Thank you, Molly. So where we left it is that the language as it stands now is acceptable to the negotiating parties. And especially I saw enthusiasm for Representative McCrate with a list of members of the stakeholder or the working committee. So it would get rolled into work that's already being done, as I understand from Dr. Landry. So with that and the reporting specifics, this feels like we're pretty close to being able to vote. Any other comments people need to make before we go to a vote? But we need a motion before that. Representative Craven.
Thank you, Mr. Chair. I move to pass as amended.
Second.
So the motion's been moved and seconded. Are there additional questions, clarification, discussion? I don't see any. So we'll turn to Ms. Withey. The motion on the floor is ought to pass as amended.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor, Representative Connor is absent. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner, Representative Javner is absent. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 11 yes, 2 absent.
So before we leave the consideration of this LD 118, I want to thank Representative McCreight for hanging in there and continue to work on this. I don't often comment on bills, but I feel like this represents a significant step forward. It gives the committee some additional resources which to follow up on this issue, and some responsibilities we didn't have before and should have. So I appreciate that effort. I appreciate Dr. Landry and the department and their willingness to work with the sponsor to get to a place that works for everybody. I think it's a big step up. So thank you for that to Director Landry and Ms. Bogart. So any other comments? So that allows us to move on to, and slightly out of order at the request of the sponsor, to move to consideration of 1148.
Okay, 1148. This is a resolve to increase broadband access in PNMIs. This resolve requires directs the department to work with providers of all levels of PNMIs to determine ways of providing no-cost broadband access to residents for medical, educational, and recreational purposes through changes in main care and grant-funded contracts. The department is required to submit a report, including legislation, to this committee by the end of the year, and the committee may report out a bill. You heard during the public, now I've got to go back up again. During the public hearing about the issue of technology being particularly important during the pandemic, and there was federal grant money for nursing facilities, but not assisted living. You heard about the disparities in access to technology for people with disabilities. And the particular concern, I believe, here was the where a PNMI actually had broadband but didn't make it available to the residents, rather than a lack of broadband issue in particular. And there was also a request that if you were going to move forward with this, to include a member from the rural broadband community to participate in the front end of this process. So this is drafted as all levels of PNMIs. I don't know if it includes all appendices. So the levels relate to size, and then of course the letters relate to the kind of PNMI. And I'm assuming that this relates to all of them, because a lot of the PNMIs you hear about are Appendix C in particular, and that's the larger ones for the elderly. But this was a CCSM bill, I believe, and so I think that would include the Appendix E. So I think the intent is to include all of them. You did ask for information about the greatest need for broadband, but I'm just going to basically skip over that, because I do feel that that was an issue about access to broadband from a technical sense, rather than a decision by the PNMI. Except I do just want to draw your attention here that sometimes access for residents is an internal system thing, and the facility will want their network for records secure from the patient network. It's a little over my head, but you also received a survey, which I can pop to in a moment, from MHCA surveying their PNMI members. And then also, I didn't know whether changes in main care and grant-funded contracts, that language, I don't know whether changes in main care is a possible thing. I'm just not entirely clear on that. So I did reach out to the department about that, but it was kind of a late question, so I don't know whether they would have an answer to that. And then I do just want to go over to here. Just you all would have received this in your email, and not really what I know. I mean, I know it was a small survey, but you received that survey response from Rick. I'm assuming these are more of the Appendix C folks. I'm really just skipping over this for the purpose of the public, because you did obviously receive this in your email and it will be posted eventually. But if you have some questions about that, I'm hoping that Rick is here. But that would really be something that you would want to ask him about.
Okay, does that prompt any questions from the committee? Any thoughts, feedback? Yes, Senator Moore.
I don't know if I'm losing my mind or not, but Anna, did you forward us the bill analysis for this bill? I'm not locating it.
Well, it's always possible. I forgot, I suppose.
And it's not posted online either. So
no, none of them are posted, Senator, until afterwards. But I can just send it now in case I did miss it. It's certainly possible.
On our list. Thank you.
Well, I'm an idiot. That's what that means.
That's a little harsh. The chair won't.
For a lot to keep track of.
The chair won't let that stand. Yeah, the chair won't let that stand.
We won't accept that.
It'll be stricken from the record.
Thank you.
All right.
Well, sorry about that. I don't know what happened there. It was certainly unintentional.
So that's coming. I see you, we've been joined by Rick Erb, but I want to go to the sponsor first, Representative McCray.
Thank you, Mr. Chair.
Analysis?
Yeah, thank you. And thank you for moving this next to the other one. Simone Moline is here from CCSM if you have specific questions about the appendices. But yeah, I appreciate Anna clarifying that this wasn't, EUT is working on getting broadband access everywhere in the state. This isn't about that. This is about if there is access where the facility is, residents should have access because they can't afford to pay for it. And the chart's interesting. There are clearly some where that's not the case, and that's why CCSM requested that I put in this bill.
Okay. I don't see any other comment in the committee. So do you have anything, Mr. Erb, that you'd like to clarify about what you presented? As I understand it from correspondence, you heard back from 27 facilities of the 140 that are Appendix C? Okay.
Right. Not all 140 are members of Maine Healthcare Association, so it probably represents a little over a quarter of our members. I would say we have about 100 PNMI members. What we got from limited response was that those that have broadband in the facility allow their residents to use it. There were one or two that separate the charge for that, but most of them incorporate it into their private pay rates. I don't think that there would be any way to break it down for the main care rates. That amount is what it is. So the ones that we heard from, it doesn't appear to be a major issue for this point, but I'd be happy to work further on this. As I understand, the bill does call for further study. We'd be happy to participate.
And just to be clear, we are talking about the bill really addresses access in the setting of existing broadband. It doesn't involve expanding, so we can leave that off the table. That's not our responsibility. The other issue is it's probably more of an issue in the Medicaid population, the main care population, than it is in others. So that's a question I'd ask of Molly. Would it be possible to add access where it exists to broadband to the standard contract, for instance, that gets negotiated?
I think that's certainly something we could consider. That was the clarity that I think we would be looking for if this were to pass, is how exactly it would be expected to be implemented. But contract language or, a notice to facilities are certainly all things that we could consider. Exactly how that looked to implement, I would need to chat with Maine Care and the Office of Behavioral Health before laying that out for you.
Sure. And I think Representative McCray, you mentioned Ms. Malign. Yeah, we'll bring her in. So she's coming along. Representative Perry, you had your hand up?
Yeah, I really have a question about broadband width and the demands that might exist and really diminish the ability of the Wi-Fi to work for the business of the facility itself. When there is an over demand, then it becomes problematic all the way through. So I think there is a concern about that, and to I don't know how you would mitigate on that piece of it.
Okay. Representative Baldacci, you had your hand up?
Yes.
Senator
Mr. Chairman,
Baldacci, I'm sorry.
That's either way is fine. So one, I just wanted to say this is a very important bill. I think the testimony that I find the most persuasive really is the fact that we have limited people to $70 a month, and the access to this Wi-Fi sometimes is life-changing. It's critical. It's absolutely important. I appreciate the efforts of the sponsor really to shine a light on this. I am moving ought to pass, making a motion of ought to pass.
Okay. Welcome, Ms. Malign. Can you contribute to this conversation?
I just want to really say it is a simple piece, and simple but critical for folks that are in PNMIs that don't have access, and they're only allowed to keep a very small amount of money. So having them pay for their own private Wi-Fi is just not been realistic. So I think where there isn't Wi-Fi available, that would be the caveat. But I think most facilities do have access, and maybe spotty, but I think they can work through those things in the facilities as well. And thank you for considering this.
Sure, and I think we did hear that the facilities have been pretty aggressive about coming up with some solutions, and maybe not 100%, but nobody ever does anything 100%. Representative Perry, did you have your hand up?
Well, I'm still questioning the availability. You know, I'm looking at some pretty rural areas where the bandwidth. So what is considered availability, I guess, in terms of this for that piece, or what can be done? You know, if there's a number of streaming going on or something like that, and you're still trying to run the business and your Wi-Fi isn't working, I guess my concern is what do we consider enough?
Yep. Representative McCray.
Thank you, Mr. Chair. Yeah, I appreciate that. It's the point is people are living in the facilities and are not provided access. And the Energy Committee is working, there are many bills about improving broadband access. I think people can work out a schedule, whatever you do in your house when you don't have a lot of bandwidth. I think the important thing is, let's make sure that this is considered essential for people in these facilities who don't have the funds to pay for it. And the facility, if they don't have Wi-Fi, they don't have Wi-Fi. We're working on it as a state.
I can offer a personal experience where in my office, our Wi-Fi, our broadband slowed down incredibly. And we called IT to fix it. Turns out that one of the providers was streaming the US Open and sucking up all the bandwidth. So there is a limit, and I'm reluctant to put a discussion of bandwidth into statute because I think what's okay today is not okay tomorrow. I think the intent is really to get people access, as I hear it, where it's manageable for the organization. The intent is not, yeah. So that brings me back to a relative reluctance to put it in statute. Is there some other way we could move that along? Senator Baldacci.
Well, I was going to say this is also prime time for this bill because we're receiving probably $200 million from the federal government for broadband, if not more. The governor is going to have to work on a plan. So I think, as the sponsor just indicated, really, this bill be passing and this group starting will help make sure that this issue is at the table as the state is putting together broadband plans. So I think the timing is excellent and the issue is very important. So I'm really happy to support this bill, and I would urge my colleagues to do the same.
Representative Lemlin, you had your hand up.
Thank you, Senator. Just one quick question. Is this bill specifically only a study?
And how do you read that, Anna? I'm looking up the language.
When I read it, Representative, it says that the department shall work with providers of all level of PNMIs to determine ways of providing no-cost broadband access through changes in main care and grant-funded contract. I suppose you could say that's a study. It's not entirely clear to me whether that's study this or go actually do it. I think a clarification would be perhaps helpful.
Yes, that's why my question is there. I can't tell if it's just a study or if this is something that they're going to demand of these organizations. So I would like clarity, please.
It is in the form of resolve, so it wouldn't end up in statute as I understand it. And let me just get some clarification. Representative Lemlin, would you be more inclined to support it if it was in the nature of a study as opposed to a mandate?
Yes, at first, because
mandate for the entities.
Yes, sir. At this point, I would.
Okay, just to clarify that, Senator Baldacci.
Yes, I read this, one, that is a resolve, and two, there's no mandatory language here. There's no authority to force anybody to do anything. I think the bill as it sits is clearly a fact-finding mission, whether you want to call it a study or commission or whatever, but and if we need clarity on that subject, I'm happy to add a sentence or two, that's fine. But the way I've read this is that it clearly has no mandate, but it's simply an effort to make sure this issue gets at the table, that people are addressing it, that the department is working on a plan. The way I read it is they report back to us. So, but if there's a necessity of us adding a sentence indicating that this is, that providers can participate on a voluntary basis, I mean, because we can't use the force of law if it's not a statute. But I'm happy with making sure it's understood that the department cannot force people to participate.
Molly, did you want to weigh in about whether the department's comfortable working on this issue with?
I'm not sure if it's.
Go ahead.
No, I'm just not sure if it's my internet or yours, but I missed part of what you were saying.
May have been my language.
Timely.
So the question was, is the department okay with this being a study to address this issue?
I mean, I think you've heard from us a number of times that, we are not generally inclined to be happy with studies versus, either a directive or not. I think one of the things that the department sort of read into this bill as we were reviewing it initially is that is a level of concern that we are not broadband experts. And I recognize that that is not the intent of the sponsor or the Consumer Council, but anything that puts us in a position of working to increase access to broadband, I think puts us in a place that's not really our role. Right. As far as, requiring providers to make sure that they are extending access to broadband to clients who are living in their facilities, I think that is it. from my perspective, it would be more clear if we either had that directive or we didn't have that directive. I think that's a relatively clear ask for us, but studying availability of broadband and, having
that's good. Okay.
specific facilities would implement, I think would be something we'd be concerned about.
Okay.
Doing.
So before I go to Representative Zager, Representative Crite, would you be okay with this as a directive for the department to work on access?
Yeah, just as Molly said, it by no means is this an expectation that the department will take on how facilities get access. It's how do you make this possible for the residents to have it? Working with them, saying you have it, provide residents need to have access. How are you going to do it? Is the way I see it.
Thank you. Representative Zager, did you have your hand up?
Oh, I did. I just put it down. Thank you, Mr. Chair. Because I think that what I was going to offer would not move the conversation forward. Based on what others are saying, I basically would just kind of hit ditto, and so I won't.
Okay. Can you, Anna, make this clear that it's a directive to work with providers who have Wi-Fi to make it available to the folks who are in their entity?
I think so. I just want to ask Molly a question about that. Although she's got her hand up, so perhaps she's already anticipating it. Are you looking for the language about? I'm just trying to find where it was on my page. The adding the access where it exists to the standard contract. Is that what you're looking for, Molly?
Yeah, I think the words "work with providers" is a little concerning to me. I think if you're telling us to require providers within our contracts to extend broadband access as available, or however your language is, that's something we can implement. Working with, to me, intimates that we would be helping them do that work, which is just not our role.
And that's clearly not the intent of the sponsor. So as we've heard a couple times, Representative Meyer.
Thank you, Mr. Chair. Yeah, I think I'm leaning towards, if we're going to do anything here with this, focusing in on the contract language. It's not clear to me what a directive to the department to work with providers really means.
Okay. How about a directive?
We've identified the problem, and that we're looking to address equity here. And I'm not entirely sure we need to legislate this. The problem is clear. And if we're going to do anything, I would be comfortable with the contract language alone.
Okay. All right. And I've heard that that's acceptable too. Representative Perry.
Just a bit of a concern. A lot of these agencies are struggling to just stay alive in many ways. And so my question is this going to be an added cost that is going to be a requirement within the contract that, again, because of reimbursement issues and stuff, that we are just adding another cost to an agency that is struggling?
Okay. And we don't have a fiscal note, so we can't sure, but it wouldn't probably cost too much to add it to the contract. And I defer to Molly on that.
But I want to argue with that. I'm not talking about the cost to the state.
No, I understand it. I was running through a list and I hadn't gotten beyond Molly yet, which is the place we always start, right? So I was then going to go to the institutions and whether the subscriber fee is based on number of users or things like that. That's the unknown. That's the big unknown. And I respect that, Representative Perry. Representative McCray.
Oh, I'm no expert on broadband, but if it's in the facility, it's in the facility. So I don't see why that would add cost, but.
Yeah, well, that would require us to define broadband in statutes in this area, and I don't think we want to go there.
I don't.
Yeah, exactly. So the real issue is access to internet, and we should leave out broadband. And we could have Molly work on what would be required to get it into the standard contract with the folks at DHHS. Does that give you enough framework? Was that a question in that head tilt, Senator Moore?
Yes, thank you, Senator Claxton. I'm really getting very confused. I guess when I was looking at this bill initially, my thought, first of all, I thought we don't even need it. After reading, seeing the survey, and most of the PNMIs already have broadband, and they do allow their tenants to actually use the service. And then our discussion today, we went from this is going to be a study just to see how it is being provided in our PNMIs. And now we've moved to including it in the contract, where if they have it, we're in a sense directing them that they have to provide it to those that are there. So I'm really confused on where we're going with this bill.
We're considering possibilities, and maybe too fast and too varied. I will accept that. All right, Senator Baldacci.
I think sometimes that I mean, this is a very simple bill. So I don't know how and the way I read it, and I'm happy to, if people don't read it the same way, but what I'm seeing is that we're telling the department, because it says shall work with providers. We're directing the department to work with providers to determine ways of, and I'm assuming if you want to say, of expanding broadband access to residents through changes. All we're asking is for them to strategize, to see what's available. We're going to have a whole bunch of stuff coming in this, or being affected. All we're asking is, we want you to talk to the nursing homes and the providers and try to discuss ways that we can promote better broadband across the board, because rural areas, particularly rural areas that have nursing homes, I think there are challenges, and residents deserve to have an opportunity. So I read this bill very simply. I think we're making it more complicated than it needs to be. And I think all we're asking the department to do is to work with people, develop a, discussion regarding, how do we promote this, especially in rural areas, and, what can we do together? I don't see it as a mandate. I don't see it as forcing anybody. I mean, this is an important discussion, particularly when the federal government is going to be providing the state a couple $100 million to talk about universal broadband. So on a simple level, I think this is just asking for the development of a plan to promote it with facilities and with patients. That's all. So maybe the person reads it that way, but I think that's clearly straightforward from the language that's been provided.
How about a clarifying phrase, Anna, following PNMI or a reference to those with existing Wi-Fi? That's who the department's supposed to work with, those with existing Wi-Fi.
You could do that. I still don't know what changes in main care and grant funded contracts mean. It still doesn't refer to all of the PNMIs. I mean, I know it might seem simple, but the devil is always in the details. That's why we look at every single word of this. It doesn't require a study. It doesn't include the folks who came to the public hearing and said, don't leave us out because we're actually the broadband experts, and then you tell us afterwards what you want and we tell you we can't do it because you didn't ask us in the first place. It's up to you what you want to do, but if you want to study, you can do a study. If you want to direct the department to work on the contracts, you can do that. But you will have to decide.
And that's what we're trying to do. And so what I've heard so far is we've narrowed the conversation down to, at least in the most recent session, a discussion of doing this for main care patients as part of their contract, and see if that's where and directing the department to do that. But again, it applies only to those entities with existing internet access. I think we ought to strike broadband and replace it with internet access. Okay, Representative Griffin, you've been patient. It's your turn.
Thank you. I just have a thought. I don't even know if this will work, but is this one of those times when, because things are getting so confusing, just a letter to the department just to keep an eye on those that are on Medicare, main care? Just a thought.
Mm-hmm. So don't confuse Senator Moore. Now you're offering a letter. But no, all the things are on the table. All these things are on the table as possibilities. Thank you. Representative Meyer.
Thank you, Mr. Chair. I'm wondering if we might take a few minutes to caucus.
Okay, I think before we do that, can we hear from Molly first?
Thanks. I just wanted to flag, I heard you say, for folks who have existing broadband or internet access. And I don't, along the theme with devil in the details, I don't think we have a record at main care or OBH of who has broadband access. So that would just potentially be a challenge if we were asked to only require that of and enforce that of facilities who have broadband.
Okay. Are there other points to consider before we go to a caucus?
I would just ask that the sponsor of the bill be included in the caucus.
Sure. Okay. All right. So we will break until 11:30. That'll give everybody a 5-minute break before a 10-minute caucus or a 10-minute break before a 5-minute caucus. So we'll be back here shooting for 11:30. Thank you. Representative Perry, when you walk away from your desk, it's kind of like a Harry Potter moment. You sort of recede into that background and then just disappear. So Anna's here. All right, so it looks like we can resume our work on LD 1148. Senator Baldacci.
Thank you, Mr. Chairman. I would first withdraw my motion, which I think lacked a second. And I would make a motion of ought not to pass. I would indicate that I'm adopting the Griffin Amendment, which is to direct a letter that, in addition to the ought not to pass, that we direct a letter to the department setting out the goals sought by this legislation and indicating to the department that is is of utmost importance to our committee that this issue be explored with providers and to provide equity and access to residents across the state at low or no costs, however the chairpersons wish to, wordsmith the letter. And so I would move to ought not to pass with that caveat.
Senator Moore, are you looking for your unmute button?
I second that.
Okay, there's a motion and a second. All right. You lost out, Senator Moore. All right, so what other, are we clear enough in the content of the letter? Anybody else want to refine, make a suggestion in terms of what we've heard? Senator Moore.
I mean, I'm pleased with what we're looking at. I'm kind of thinking in the suggestion to the department that they might even consider a survey very similar to what Rick Erb did, sending it out to all the PNMIs, just to gather that information.
Okay.
As a suggestion.
Right. And how about the inclusion of a goal of free access to Wi-Fi for residents?
Sure.
So we'd add that in the letter.
Yeah.
Yep. Okay. So then the question goes back now to Anna. Does that give you enough to work with? Where'd she go? There she is. To draft a letter.
Yeah, that's fine. Do you want it copied to Maine Healthcare Association and some of the providers?
It should get to all the PNMIs, however we need to do that.
Yeah, well, I'm sorry, I'm not sending a letter to every single PNMI, but I'm happy to send it to organizations that represent PNMIs. But
That's exactly what I meant.
Yes, but I have a question about that. That's the point. I don't think, Rick, you don't represent all of the PNMIs, right? I mean, you represent Appendix Cs mostly?
We don't represent other types of
right
other than C, and we don't have every single appendix.
No, that's fine. Yeah, I wasn't, my issue wasn't about like every single member, but I wanted to ask Simone if she thought there was a particular way to get at the PNMIs that she's looking at, which are not the ones that Rick represents. I realize that's part of this issue, I mean, Rick's PNMIs, but I didn't know whether there was somebody that we should copy that Simone would want us to, that get at the folks the providers she's looking for.
Do you have a suggestion for us?
I would think between the Alliance for Addiction and Mental Health and the Collaborative, they cover both substance use and mental health PNMIs for adults, children, and all the other appendices. There may be a couple outliers, but I think with what you've got so far, I think would hit almost everybody, if not all.
Thank you.
Mr. Chairman, I'm wondering to follow up on Senator Moore's suggestion about a survey, whether we can mention a survey and or establish a working group.
How about it's non-directive? How about if we leave it that they consider a stakeholders group and or a survey and or a
And/or
survey,
a survey. Okay.
preceded by the word consider.
Yes. Thank you.
Is that acceptable, Senator Moore? Okay. That was a head nod for those of you who are not viewing us. Okay. All right. So the motion on the floor now is ought not to pass with a letter to be sent to as many PNMIs as we can reasonably reach. To organized PNMI.
The representatives of them. Yeah, not the
Representative, yeah.
PNMI specifically, but the organizations.
Organizations representing PNMIs in the state. All right. So I think it's, that was moved, and I heard a second, I believe. And so that takes us to Ms. Withy for consideration of that motion. Would you record the vote?
Representative Zager.
Yes.
Representative Zager, yes. Representative Lumlin.
Yes.
Representative Lumlin, yes. Representative Stover.
Yeah.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Okay. Thank you very much for that. And thank you to Representative McCrate for making sure this was brought to our attention and for her work to get that to people who really need it in the current circumstances. Okay. So now we'll go to consideration of LD 287.
LD 287. So this is an act to require EBT cards to be printed with the beneficiary's photograph. This bill requires the commissioner to place the photograph of a recipient on an electronic benefits card by removing the requirement that the recipient must agree in writing to have their photograph on a card. It's slightly awkwardly drafted, but that's just a function of the current law. You heard from the sponsor that there's particular concerns about the SNAP error rate and the integrity of the program. And you heard that opponents don't believe that the photographs improve integrity and that it's expensive. And there are issues with federal law and regulations requiring all customers to be treated the same, including exemptions from photographs for a majority of recipients and allowing for the use of EBT cards by other individuals. The second sentence is amended in the bill now states that a recipient of an EBT card who is a minor or an incapacitated individual may have a photograph of the parent or legal guardian and strikes out the if agreed in writing. It's not clear to me when I read that sentence without that whose photograph is supposed to be on the cards of these recipients. I just think it's a drafting error, that's all. There is also no provision for the exemptions that are required by the federal regulations. Maybe that doesn't matter because the federal regulations are going to be more, above state law anyway, but there is no exemption in there. So you had some additional information, and I'm going to come back to this piece in a minute because you do have a memo about it, but I did ask the AG, you requested specifically information from the AG's office, but the AG's office said that they don't typically do EBT fraud cases because absent a special circumstance, they have a $5,000 threshold for prosecution of felony theft cases, and EBT cards do not usually meet that threshold, which is why I'm only pointing that out because you specifically asked me to ask the AG's office, but in fact, any answers you have about that have come back from the department. rather than the AG's office. So you also had a question about the cost of reinstating the photo ID. That I didn't pass that question on to the department because it was already in their testimony. And there was also a study that was cited about the costs of that. The list of individuals that are exempt from the photos, you'll be able to see that when you look at the federal regs, but those over 60, under 18, homeless, victims of domestic violence, those with disabilities, and those who have a religious concern. And then I'm going to skip over these because you have a memo in a moment that you can look at. There was also a question about the issue of having to treat all consumers the same. Generated the question about whether stores are supposed to ask all of the rest of us who don't have EBT cards for ID and signature. So I asked Colleen McCarthy-Reid, who staffs the HCIFS committee and knows everything about banking, and I know absolutely zero. And she said that there are no federal or state laws that require that. And credit card companies set those rules in their contracts with merchants. And if a credit card is signed, they can't require a person to present their ID, which is why when you get a new credit card, you're always required to sign it. And indeed, stores are not supposed to ask ID and signature of anybody who's using a credit card. I'm just going to scroll down here just so you know, just as a reminder about the federal law and regulations around the use of EBT cards by other members of the household, around the exemptions to the photographs, that a state agency can require a photograph, that is permissible under federal law, but that there are exemptions to who has a photograph and how those cards can be used. So underneath here, I have to stop sharing in order to get at the memo from the department. Which seems kind of ridiculous, but it's just a function of it sitting right underneath my sharing issue. So I'm going to go back to it now. So I'm just going to open this up for you. It's obviously not my product, but you did have these questions here, and I just want to. I don't know whether you want me to have it open and go through it, or whether you want me to have open and have Molly go through it, or whether you want me to just stop sharing and shut the heck up, and Molly can go through what's on there. But you did have the question about fraud, and you can see there that the fraud investigation and recovery unit sent 94 cases of suspected EBT card fraud for prosecution in the past 3 years, including one really big one. You asked about you asked for a breakdown to get at this exempt, non-exempt issue. So you can see there that the total population with SNAP, and this would be the population 18 and over, and then these 3 boxes at the end here would be ones that would be exempt. At least that's my understanding of it. Just a reminder that error and fraud are not the same. And then Representative Javner had a specific question about who under 18 might be eligible for SNAP. And so you have an answer there that that there are certainly individuals under 18 that are eligible for SNAP, but they're often part of a family, and that there's just a few that are on their own. And then who can use the SNAP, you know, who's eligible. If you are a person with SNAP, who can go and do your shopping for you? And the answer is that anyone can use the SNAP card with or without a photo, providing that they have the card PIN and are shopping for the recipient's household. I think I managed to remember to put that in the, I'm sorry, I left off 1148, but I'm pretty sure that was included in the giant, she's shaking her head at me like I'm certain I included that. Oh, you know what? I didn't, because Molly sent it directly to you. With a number of other, that's right, thank you, sorry, that's why she's shaking her head at me, because you received an additional email from Molly after I had sent out the big email that included all of the products that came from the department.
So Anna, I did not get the actual bill analysis for this. I don't know whether I'm missing an email or what happened with that. I got the memo, but I didn't get your analysis.
You just all carry on talking while I send another email.
We're busy watching you.
We'll
No
carry on
pressure.
talking.
No pressure. All right, so does that analysis, while we're pending referral or review of whether the analysis got sent, does that raise any questions for folks at this point? Any questions that will go to Anna when she rejoins us? I'm not seeing any. All right. Do you have enough information to get to a vote, Senator Moore? Or would you like to slow the proceedings down a minute?
Senator Claxton, I'm okay. I guess I'm just being anal about making sure my folder has everything in it. So
Oh, okay.
So I just resent the email to you, Senator, the one that I sent yesterday in the middle of the day that included all the bill analyses. I don't know. I didn't check for 1148, but I did check for 287.
okay. Wow, I don't know what happened to that. Okay, thank you.
But it's on its way to you again. It's a giant email with a bazillion attached.
Any other comments, questions? All right. Yes, Representative Craven.
Thank you, Mr. Chair. I would like to make a motion because of ought not to pass, because I think that with all of the testimony that we heard during this public hearing was compelling, that this is something that didn't work before. It doesn't work in other states. And so I would move ought not to pass.
Thank you. Is there a second?
Second.
Okay, there are seconds. So there's a motion on the floor for LD 287 ought not to pass. Is there any discussion about that? Not seeing any, then I think we can go to Ms. Withy for the vote.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
No.
Representative Lemlin, no. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
No.
Representative Griffin, no. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 8 yes, 2 no, 3 absent.
Thank you. So we can move to LD 910.
Actually, we need a moment. I'm sorry. I need a minority report and I just want.
I'm sorry. Yes.
Just ought to pass.
Would you like me to put in any of the correction about the last sentence? I don't think it needs to be changed. By changing it to say that when a recipient of benefits is a minor or incapacitated individual, the commissioner may, I guess it doesn't really matter, but it seems to me that it's already permissive language. And I didn't know if you wanted that fixed or and whether you wanted any exemption language clarification.
Is it possible? Okay. Yeah, you can, that's fine, Anna.
Okay, so that would, yeah.
Is it, this is just a thought, this is just my thought. Is it possible to amend it so it's the person's choice whether or not to put their picture on there, or is that a whole different can of worms?
You would,
It's just a thought.
Well, I think that here's the issue with that, Representative.
Okay.
So the ought not to pass motion that the majority had means
Yes.
that we go back to the original law. And the way that the original law, which was, amended in 2017, that is the language that has the choice. So here's how current law reads. The Commissioner shall place a photograph of a recipient of benefits under a program specified in Section 22 on a recipient's electronic benefits transfer card if agreed to in writing by the recipient. And then it repeats that same language. So the ought not to pass makes it go back to the choice.
Oh, okay. Gotcha. Okay.
So what would you like me to do?
Just do what you said before, just correct.
Okay.
the language.
So that would be an ought to pass as amended, Kerry.
Okay, thank you.
Thank you for the clarification.
Jumped the gun on that one. My apologies to the minority report. So now we can go to LD 910.
LD 910. This is an act to amend the general assistance laws governing reimbursement. I think you're all fairly familiar with this right now. This is the bill that has the same language as the majority report had for the budget. So this is going back to the 90% for threshold for municipalities that are over a certain level of valuation. So I don't think you really need me to go through all of this. The only thing that you asked me was whether it was the same as the bill last year and the majority language proposal in the budget, and it is. I had one other thing I was going to mention, but I forgot what it was. The summary of the bill is incorrect, but we can't do anything about that.
But that doesn't become part of the book.
That's correct. We can't amend. We can't amend a summary. But we'll have a fiscal note. So if you want to move forward with this, you would be by definition amending it.
All right, Senator Baldacci.
Yes, thank you, Mr. Chairman. This is in the continuation. We approved an amendment. Was that for the supplemental budget or for the biennium? I think it was a biennium.
A biennium.
Okay, and did AFA not include it, or what was the status of AFA not including?
It is not included. If you want to move forward with this, you still need the bill.
Yeah, okay, I just wanted to see. And I would just indicate for the record that the arguments are the same, but primarily this is about property taxpayers, not and general assistance recipients. The city of Bangor, and this is a state mandate that we have to administer, so we have no choice in whether to provide general assistance. It is required by state law. It is a mandate that should be 90% paid by the state government, since it is a state mandate and it's a very expensive mandate. In Bangor, the budget is close to $3 million. I understand we have a pandemic, but even before then, it was around $2 million. This is an annual expense that's very significant for property taxpayers. It's very important as an absolute safety net for people, but it's also about property tax relief. So I would really urge my colleagues to support this if they care about property tax relief, as well as making sure that the general assistance budgets are funded and that the cities don't have an overwhelming burden. So I would move ought to pass. I think it's ought to pass as amended, right? Or
yes.
Yeah. So I would move ought to pass as amended.
Is there a second for that?
I second that.
I see a second. All right. So the motion on the floor is ought to pass as amended. Been moved and seconded. Is there any discussion, any questions? This is familiar territory to all of us who've been through the work before, the budget work. Okay, so I guess that goes to Ms. Withy for the vote.
Representative Zager,
Yes.
Representative Zager, yes. Representative Lemlin,
No.
Representative Lemlin, no. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
Yes.
Senator Baldacci, yes. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
No.
Representative Griffin, no. Representative Connor, Representative Connor is absent. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan, Representative Madigan is absent. Representative Javner, Representative Javner is absent. Senator Moore,
No.
Senator Moore, no. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 7 yes, 3 no, 3 absent.
I'm sorry, could you repeat that again? My brain was elsewhere.
7 yes,
Okay,
3 no,
Yeah.
3 absent.
thank you for
Mhm.
repeating that, sorry. And minority report,
Ought not to pass.
okay? All righty, so that moves us to 873.
All right, LD 873. This is a resolve to waive reductions to nursing facility reimbursement resulting from payroll protection program loans and grants. This resolve requires the department to waive any reduction or adjustment under to allowable main care costs on file or audited cost reports that would result from a loan or grant under the federal PPP program. It is an emergency resolve. You heard from the sponsor that although the department is reversing the offsetting policy, that you still support the statutory change. And you heard from the department that they are not requiring nursing facilities to offset PPP against cost reports. And I did attach the guidance that was sent in January below. There is a drafting issue. If the CMS guidance requires PPP grants to be offset, then the bill would be in violation of CMS guidelines. But perhaps more importantly, if CMS guidelines don't require the offset, the bill only applies to the PPP under the CARES Act or subsequent federal act. So if there is no requirement by the department to do this and you pass the bill anyway, it'll be very unclear what it actually applies to. You did ask if there's any new information from the department, so that would be a question for them. And I did attach, as I pasted it in, I realize that it's easier with an official. I would normally just forward it, but because it was the first part of a much longer email, it was more straightforward just to paste it in. But any updates, you would need the department for that.
Yes, Senator Baldacci?
Thank you, Mr. Chairman. So it's my understanding that the department's policy is they will not include this unless they get an affirmative direction from the feds. Is that basically it?
Yes, that's correct.
Okay, so I think in terms, and I appreciate the department's responsiveness. I'm happy to hear from Mr. Erb, but I would probably, because of that issue and being resolved, I probably would move ought not to pass on this bill. And then obviously if the situation changes, we would have to address it at that point. But at this point, I feel the issue has been settled satisfactorily.
So there's a motion
I would second that.
and a second. Are there additional discussion of that motion ought not to pass?
I would just ask if Mr. Erb could comment and see that's satisfactory on this issue.
Mr. Erb?
Certainly. Thank you. I would concur with Senator Baldacci that the information that was received after the bill was filed does satisfy the situation from our point of view.
Okay, thank you.
Do you feel obliged to chip in here, Ms. Bogart, as long as we're finishing up conversation about this?
Just to echo that guidance was also sent in January, but thank you.
Thank you. So there's a motion on the floor, ought not to pass. It's been seconded. Additional questions or comments? So we will go to Ms. Withey for recording the vote.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lumlin.
Yes.
Representative Lumlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Okay. So let's go to 9:49. And after that, we'll take a break for lunch.
Which will be good, Senator Claxton, because I have to bring up a whole new set of documents and I don't have any of them ready to go. This is the last one I have sitting on my screen ready to go because it was all I could fit.
Perfect timing, and we'll be a little over halfway through.
Okay, LD 949, this is a resolve to restore the main care nursing facility COVID-19 temporary rate increases. This is the resolve that requires the department to amend their section 67 nursing facility reimbursement rules to increase reimbursement rates to rates that are no less than the rates that were in effect on May 31, 2020. These are the TRIs that you have heard about before. And the increased rates must remain in effect until at least until the end of the state of emergency declared by the governor. And the temporary rate increases to nursing facility funding with federal funding were in effect from March 1st to May 31st of last year. You heard from the department about their declines in residency due to COVID and shortages of staff that result in expensive temporary staff that have worsened with the pandemic, and that there are additional costs from COVID itself, testing, PPE and supplies. The TRIs are there for you, and the department said that the cost increases came to an end because of cost concerns and were replaced with increases for facilities with outbreaks, and those are a direct care add-on. And the department recognised bonuses intended to help ensure staff retention during the public health emergency. There was apparently a meeting between the Maine Healthcare Association and the department, so you would need to ask them about that, and we don't yet have the fiscal information from OFE.
Can you explain the sentence, recognizes bonuses intended?
No,
Does
you would
that
have
mean-
to ask the department to explain what that means. It was in their
Okay.
testimony, but I don't, you would want to ask them about that.
So we have 2 questions for Ms. Bogart. What does that phrase mean, recognizing? And can you give us any update on a meeting?
Sure, and Deputy Director Mann is also in the attendee list for this bill, and so I would ask your indulgence in inviting him in.
Done.
And so we can certainly track down that testimony was from Maine Care Services, and so we can check in with them. But you know, Ben can talk about the meeting. We met with Rick yesterday morning to talk about additional relief for nursing facilities. So I'll hand it over to Deputy Commissioner Mann to fill you in.
Welcome, sir.
Nice to be back. Nice to see you all. Yeah, just as context, we are actively discussing additional support for nursing facilities. We are working with Rick and his association on that. So that would look to help with staffing shortages and increased costs related to the pandemic, as well as the occupancy issue that nursing facilities are experiencing in the aftermath of the pandemic overall and the surge that happened over the winter with new cases. You know, we just, I know you all are aware of this, but you know, those temporary rate increases were in place last year. We're mindful that facilities that experience an outbreak are particularly affected, which is why we continue to have outbreak rates in place for those facilities during those outbreaks. This department has been covering the cost for nursing facility testing reimbursement since the end of October last year. And we also have supplied significant amounts of PPE to nursing facilities and other facilities that, you know, I think we are in alignment with the nursing facility industry that occupancy levels are causing issues for facilities. And like I said, we're actively working with them on developing a plan for what future support looks like going forward for the rest of this calendar year.
Are there questions of Deputy Director Mann? Yes, Senator Baldacci.
Thank you, Mr. Chair. Deputy Director Mann, thank you very much for your work and your presentation this morning. I would like to hear from Mr. Erb, but assuming that it's consistent with what the Deputy Director said, I'm asking whether it might be appropriate to table this measure, and I would prefer tabling it for the fact that I'd like to revisit or not before the end of the session, depending on how the discussions go in terms of the nursing facilities. But if we could hear from Mr. Erb, I would appreciate it, Mr. Chairman.
I seem to have lost the ability to promote, so I'm going to defer to Carrie. There we go. So he'll join us shortly. Carrie, can you help out here? I can't seem.
Yes. Sorry, Senator Claxton. I've tried promoting Mr. Erb a couple times. I think he's finally making it through.
Okay.
There he is. Okay.
It took us multiple attempts to promote you, Mr. Erb. Sorry about that. All right. So did you hear any of that conversation? The question being tabling versus ought not to pass was raised. The issue of negotiations being ongoing was presented by Mr. Mann. And any questions you have specifically of Mr. Erb, Senator Baldacci?
I wanted to just get Mr. Erb's sense of things from his perspective in terms of these discussions.
Yep. As soon as you're unmuted, we'll be glad to hear what you got to share.
Thank you. I would confirm that we are going to be meeting as soon as tomorrow morning. I appreciate that Ben and the department are expediting discussions that are going on. I would hardly endorse tabling the bill at this point until we know what the direction is going to be. We are certainly facing many challenges right now the areas that Ben spoke about, occupancy, staffing, COVID-related costs, all of those. The rates that apply during outbreak are appreciated, but there are many costs associated with the COVID-19 pandemic that happen outside of outbreak. So I would just ask that if we could continue this discussion later, we will continue to meet with the department, hopefully make progress.
Mr.
Very
Chairman,
good.
Mr. Chairman, I was moved to the table.
Was that a move to table, Senator Baldacci? There was some
Yes.
background noise. Okay. Is there a second for a tabling motion?
Second.
Okay. So all of those in favor of tabling, please show your hand. I don't think we need to run the route on that. That's unanimous of those present. For those who are listening in, the motion has been made and voted to table. As long as Mr. Mann is here and Mr. Erb, do we have some sense of when these negotiations might be concluded so we could revisit this and get me out of trouble with the presiding officer for having too many bills on the table?
I would hope that we would have substantial progress next week. I know that there's some information Ben has asked me for. It'll take me a couple of days to get that together. So I know on my end, I have that. We're going to provide more information to him by tomorrow morning. I don't know, Ben.
Yeah, I hesitate to put exactly a time frame. I think we can report back progress. I certainly intend, the department intends to move this forward in a quick fashion so that we can get what we need to get done. And I know we met yesterday, we met a couple of weeks ago as well. So the nursing facility reimbursement is complicated and there's details to work through. So I don't want to put a too granular time frame, but this is a issue that we're prioritizing.
Okay, so we're talking about weeks. That's how I wasn't talking about beyond generally. Okay, so I'll need a signed note for my PO that includes Molly's signature and Rick's to that extent. All right, so we've tabled 949. That seems like a good place to take a break. We'll come back with consideration for consideration of the remaining bills. And so I would entertain a motion to adjourn until 12:45.
So moved.
Wait a minute, there's a question from Representative Griffin.
I was going to say one till adjourn to one, but I'll do whatever.
No, we can do one. Let's take a longer break and try and, yeah, that sounds good. All right, so we'll return again at 1 o'clock. Is the all those in favor with a show of hands? Unanimous of those on screen. There we go. Okay, so thank you very much. Thank you for that suggestion, Representative Griffin. We'll see you back here at 1 o'clock.
That may have been the longest break we've taken yet.
That was welcome.
Sure was.
I'll send a thank you note and flowers to Representative Griffin.
Well, thank you. Because the host had stopped it.
Hopefully Anna got some lunch while she was rearranging her desktop.
I discovered what happened, why I didn't see her email. Molly's came in right behind it. And so I read Molly's, but didn't go down far enough to see Anna's. So that's why I was missing all of the analysis.
That's a problem. I had to ask Molly for an attachment. Well, it was there, but it was about 4 emails down.
That's it, because it kind of layers them. Yeah.
It doesn't tell you that there is one there.
No, it doesn't. It's weird. And then when I was doing a search for Anna, it wasn't coming up because it was down with the Molly's.
1, 2, 3, 4, 5. All right. We said we'd be back at 1 o'clock, and we're doing pretty well with our timekeeping. So we'll restart this afternoon's or today's session of Health and Human Services. We started this morning, ran into the afternoon. We have 6 more bills to consider, and we'll just go directly to LD 1001 if Anna's ready.
All right. This is an act to ensure parents' access to their minor and adult children with special needs. This bill directs that even during a state of emergency, parents and guardians of children and persons with special needs who are admitted into the hospital or care facility be allowed access to a child or person with special needs unless the parents or guardian's access has been limited by a court. If a parent or guardian is unable to exercise access to a child or person with special needs, the parent or guardian may assign another person access to the child or person with special needs in that person's absence. And this is an emergency bill. So proponents, individuals with special needs cannot always communicate with facility staff, but can usually communicate with their parents or guardian, and the ADA takes too long to resolve. They also oppose the CDC guidance for safe visitation. And people with developmental disabilities have not been accessing healthcare during the pandemic, sometimes because the caregiver is not allowed to be present. You heard from some opponents that the hospitals always want family members present, especially in these types of circumstances, that parents and guardians of children and persons with special needs are allowed to visit with certain restrictions. And some of those restrictions were the person having symptoms of COVID, travel restrictions, parents with COVID. And that only in extreme danger did hospitals not let family members in, and hospitals actually cancelled surgeries and asked people to wear masks when possible. Disability Rights Maine stated that the ADA requires reasonable accommodations, that including allowing a caregiver when other family members are excluded, and the Disability Rights Maine believes that the ADA is sufficient to address those concerns. Also pointed out that the bill is drafted generally to include consent not being required. The department, as drafted, access could mean video and telephone. If access is interpreted to mean in person, then the department would be opposed. So there are some drafting issues here. First of all, there's the testimony from Disability Rights Maine and the department around definitions, consent, and types of access. Also, this bill as it's drafted notwithstands Title 37, Chapter 13, that's the MEMA chapter. And then this bill is drafted in the General Department Organization and Powers chapter and subchapter instead of 34B. 34B has more definitions to clarify who this would apply to, as well as the rights of persons with ID and autism. And there are some sections in there that if you were moving forward with this, it would make more sense to go there than the way this is drafted currently. Title 18C, the probate code governs the appointments and powers of guardians, various levels of guardianship, including consent for both children and adults, and medical treatment and limitations by courts. In other words, if you're going to talk about guardians, you might want to be a bit more specific. This issue has come up in some other states, both around access to care, so that's not discriminating against individuals with disabilities, and allowing support persons. So these are two sides of this issue of disability during the pandemic. For this particular purpose, this is not about discriminating against individuals with disabilities, but around the support person side of it. So the Office of Civil Rights, the federal office, has stated that civil rights statutes and protections are not suspended during COVID-19. I'm not going to click on that link, but if you were interested, that's why I sent it to you yesterday, if you wanted to look at that. I want to go further down so I knew there was something else. We haven't yet heard from the department. So this is the section in 34B around the rights and protections of a person with an intellectual disability or autism. So if you were going to do something along these lines, I would suggest to you that you would want to amend this section rather than the way it's drafted. I really don't understand why it's drafted in Title 22. I don't know how that happened, but I'm going to go a little further down here, and you can see this is the medical care section, where it states that particularly in, I think it's paragraph G, where it talks about including, actually it's this whole section. So this is the section around persons with disabilities and autism being entitled to receive medical treatment. And it also talks in here about, or establishes in here, where is it? That the person must be given information. This is the sort of consent side. And goes right down. So yeah, so anyway, the point is, if you want to do something, if you want to move forward with something that is along these lines, I think you would want to go into this section rather than the way it is currently drafted.
Okay, thank you for that. Does that raise questions for any members of the committee they'd like some more information about or put to Anna? I don't see any. I noticed that so Lisa Harvey McPherson, do you have something to contribute to this conversation that we should hear?
As we testified at the hearing, hospitals do have policies, even during COVID, to allow for visitors, and it is absolutely in our interest, and we request that family members and significant others be allowed to visit, certainly for this population, as it supports communication with our providers both ways, communicating to the patient and the patient to us. I think early on, when COVID first hit and we canceled outpatient procedures, and we were in a territory of a great deal of uncertainty, there was a fairly strict approach. But today, you'll find common approaches where hospitals are screening individuals for COVID the same way we screen employees. Individuals wear masks the same way our employees do. Visitors are allowed in. Where the variation exists is the amount of time the visitor might be able to stay or the number of visitors that are allowed. But for purposes of this population, the nursing leaders have been very flexible in seeking the support of families and others to help those patients communicate.
Okay. It sounds like you're making a case that this isn't necessary from your point of, at least from the hospital's point of view.
Not at this time, no.
Okay. Is there anything about this legislation that gets in the way of what you're doing?
What would concern me is if we had legislation that would require us by statute to allow any individual of the patient's choice in. And if that individual screened positive for COVID, for example, we would have a great deal of concern about how do we do that within CDC guidance. That would be my biggest concern. And the other time that we would screen individuals and have limits on visitation is flu. So it's not unique to COVID. Before COVID, we would routinely restrict visitors for the flu in a similar way.
Okay. Okay. I saw a couple hands up briefly. Representative Craven, did you have your hand up?
Yes, thank you, Mr. Chair. I did. I just wanted to ask Lisa if she knew of any time where a guardian or a family member was refused to see their charge, excluding if they had COVID.
Yeah, I believe testimony from Maine Health talked about a physician testified and may have referred to a specific case for an individual that was in a COVID unit, a positive COVID unit, and having a visitor in that unit presented significant risk to that individual because the unit was all positive.
Thank you.
Representative Zager, I think I saw your hand up too.
I was going to make a motion, but didn't want to stifle conversation, so I yield.
Okay. Any other questions, concerns that we should be bringing up? I see Director Landry. Did you have something in particular to contribute?
No, Senator, I was here just in case there were any questions for the department.
Thank you for being here. Representative Lemelin.
Thank you, Senator. It's interesting that I'm hearing this testimony because Millie Coombs, again, is at Maine Medical Center right now, and she has been denied access to see her daughter as of right now. So it happens all the time. And as far as the comments about disability rights, Maine, Millie Coombs also went to Disability Rights Maine, exactly what she was supposed to do. All they did was they gave her a lawyer, and that lawyer could only talk to the lawyer at Maine Medical Center, and it just got nowhere. Nobody did anything. Nobody came to help her. She was not given the opportunity to talk to her daughter. The issue I have here, and I'm kind of blown away that everybody doesn't see this. If a person like my son cannot communicate with anyone else but myself or my wife or another family member, and they admitted to the hospital, and my son can't communicate to anybody, and I'm not allowed to be there, that's sacrilege on the highest degree. And the fact that everybody on this panel doesn't see this, I respect it, but I'm blown away by it. I'll tell you right now, my son will not be going to the hospital without this bill for any reason, because I am not going to leave him there unattended where he cannot communicate with anybody, and he is sitting there in fear or frightened or scared and doesn't know what's going on, and nobody can tell him what's going on. There is no way. So I guess I'm going to have to contact the hospital and make sure that they have somebody that can come to my home and care for my son in my home, because my son's not going to the hospital. That would be the worst parenting I could ever do, and I won't do it. So also, Ms. Coombs sent me a letter just recently, and this blew me away even more. But there was hospital staff, a Mr. Taylor, that told her that while she remained in the hospital, and she was downstairs in the lobby while her child was upstairs, her adult child, and this man told her that he would no longer attend to her and they will not transport her to where she needs to be until she leaves the facility. I know this lady's not lying to me. So this is just scary stuff. And it's far more scary than the COVID virus. Nobody can tell me that you cannot gown and protect the individual from COVID. If you can protect a nurse or doctor from COVID, you can protect anybody from COVID. And that person can be told how we're not talking about thousands of people here. We're talking about a select few who cannot communicate. I'm not talking about access to just anybody. I'm talking about, and I'm willing to change the bill to be specific to those who are unable to communicate to anyone but their family members. And this can be done very easily. If the hospitals don't know how, I'm volunteering. I will come to every hospital in Maine and I will train them on how to do this and get it done properly.
Yeah. If I may, I can't comment on any specific incident that I have no information about, and it's not a Northern Light hospital. I will share with you that what I am aware of are nonverbal patients that were hospitalized during various periods of COVID. And our attempts to reach out to the facility, asking for an individual from the facility where they lived to come to the hospital and assist us with the patient in terms of communication, because we had various individuals that were nonverbal. And we were advised that the facility declined to send anyone to help us because the patient was COVID positive. So I think there's a lot of instances where perhaps on both sides it didn't go exactly the way it should have. But I will say we know far more today, and we're far more comfortable in managing COVID today than we were early on.
Are there any other questions or concerns or comments related to LD 1001? Then I guess I'll entertain a motion. Yes, Representative Craven.
Thank you, Mr. Chair. I move ought not to pass.
I second.
So the motion's been made and seconded, ought not to pass. Is there any further discussion? Not seeing any, we'll turn it over to Ms. Withy to run the vote.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin. Representative Lemlin is absent. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
No.
Senator Baldacci, no. Representative Perry.
No.
Representative Perry, no. Representative Griffin.
No.
Representative Griffin, no. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
No.
Senator Moore, no. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. Representative Lemlin,
No.
Representative Lemlin, no. That's 6 yes, 5 no, 3 absent.
Thank you. Is there a minority report? Senator Baldacci, you had your hand up?
Well, it's not towards that issue, but when you get a moment, I'd like to just register the votes for any of the votes that I may have missed.
So let's finish up with the minority report on
It's
this.
up to Representative Lemelin.
Ought to pass.
As amended.
Can I ask a couple of clarifying questions?
Sure.
So I believe I heard Representative Lemlin say that he wanted it to be specific to those who can't communicate with anyone but their family members. Is that the first piece that you would like, Representative?
Correct.
And would you be willing to let me move it to 34B into the section that I showed you in the analysis so that it's drafted in a more correct place?
Yes, ma'am.
Okay, and I will continue probably to work with you all to make sure I get that correct. Is that all right?
Right. So Senator Baldacci, maybe we can do that at the end. Do you mind collecting your votes and we'll do it all at once at the end? In case you get called away again.
Well, yeah, no, I also have to leave for Augusta because we have a confirmation session tonight. So
we'll be done by
before I get. What's that?
We'll be done before then.
Oh, okay.
All right. Let's go to 11:39.
All right, so I'm going to quickly go through this, but then there are some other people from the department and also the long-term care ombudsman program that will be able to go through much more detail than I have. So this is an act to authorize and regulate visitation of essential caregivers at long-term care facilities. This is an emergency bill. It establishes the right of a resident in a long-term care facility to designate a person as an essential caregiver who may visit the resident at the request of the resident at any time and who may not be prohibited from visiting because of an outbreak of disease or any other reason. The essential caregiver is subject to the same limitations of behaviour and entry as employees of the facility, including requirements for illness screening, testing, and use of PPE. The facility may prevent the essential caregiver from approaching any other person in the facility except for the resident, and the resident of the facility may have only one essential caregiver at a time. The proponents, you heard about the isolation from the lack of visitors at nursing facilities that was worse than the risk of COVID for long-term care residents, and that we were protecting physical health at the expense of mental health. And some family members often provide care in facilities given the shortages of staff, not because of COVID, but in general. The department and other opponents, CMS regulates nursing facilities and the state regulates assisted living. Nursing facilities and the state have to comply with federal laws and regulations or risk loss of all federal funding. Facilities couldn't monitor every visitor, especially with shared rooms. And there's a risk with untrained people providing assistance with activities of daily living and who is the arbiter of conflicts or if a visitor doesn't follow the rules. Neither for nor against, same issue of nursing facilities complying with CMS rules, and also that nursing facilities are now changing and opening up. And the CMS doesn't distinguish between types of visitors. There are some drafting issues here. The first one, it's not an issue, but you did hear at the public hearing that the sponsor is looking to include the resident's medical power of attorney. And you can see that language below there that we'd be pulling from, which is the power of attorney for healthcare. You would need to designate the power of attorney section and also specify that it was specifically for this purpose. You asked for information on voluntary programs in other states, and I do have that up on my screen, but I do know that Bill Monteo and Brenda Gallant are here to can talk about what's in those programs. You received the current opening guidelines as well from CMS. I don't have the answer to the question about the percent of Maine COVID deaths from long-term care facilities, but I think the department did bring that. And the impact of isolation on residents, I believe that was received in an email that Brenda sent immediately. Oh, and I forgot, I skipped over accidentally the drafting issue. The first was just the reminder that the sponsor had made this request of the medical power of attorney. But the second is the issue of essential caregiver. I know that essential caregiver is the term that has been used for these kinds of programs, these voluntary programs around the state. But it's particularly confusing in Maine because we use this caregiver term in the medical marijuana program. So you can do whatever you want, but that is a more confusing term in Maine than it might be in some of the other states that have these programs. So I don't know that I have much more here. Right. So I'm just going to quickly click on this so it reminds you that it's here, but you did receive this in your email as well, that goes through some of these programs in other states. They are, oh, actually that's not, yes, that's it. These are not programs that are in statutes in other states. That is a little fundamentally different from what you are looking at here. You also received these are the guidance. I'm having trouble with my computer screen. But Bill can talk about that with you. And that is the revised. You also received these, I believe, from Rick. I don't remember. They're all in a number of different emails, but I'm going to stop sharing my screen and I'm going to stop talking because I do think you have other people that know considerably more about this.
Does this raise any questions for any members of the committee? Any comments related to that analysis? Are there questions still that we need answers to? Yes, Representative Griffin.
Thank you. I just have a question about the definition of essential caregiver. If the sponsor wanted to, could she change it to family caregiver so it's more specific? It was just a thought.
That's up to you what kind of terminology you want to use. I know that the sponsor wanted this term originally, but it's up to the committee now. And I just point out that it's a more confusing term in Maine than maybe in other states. This is kind of a standard thing that I don't know who has worked on these essential caregiver programs in other states, but it's a term that they have used. It's just weird in Maine because of the caregiver program, but you can call them anything you like. I mean, it's basically a designated person.
And part of the conflict is because the term that we're referencing is in statute already.
It's not that, because I think that's just caregiver, and honestly what I know about the marijuana program I can put on the back of the postage stamp, but I do think, I mean, this is about designating a visitor. I think the other issue is that in this particular program, or in the intent behind this is a caregiver to me is specifically providing services. And I don't think that's necessarily always the case in the scenario that they're setting up here. It's really about a family member being kind of an advocate, or not being able to isolate. So I do think it's confusing, but I'm not the advocate here. I just think it's more confusing here than it might be in some other states because of the marijuana program. But I also think it has a lot of other associations with it too. I mean, Representative Griffin, you sat on the long-term care study, and we talk about caregivers there all the time, particularly in terms of taking care of people at home and so on and so forth. And this is a little bit different in that some of these family members would be going into nursing facilities, and really they might be providing care. I mean, we do know that they're short-staffed, and often family members that are visiting their family members are providing actual services, but they're not all. Right. So that's a choice for you.
The other issue would be the family advocate, just because I know there are issues with family members and friends that were really having a hard time not having somebody come and visit them. It really affected their you know, medical issues. So maybe even a family advocate. I don't know, just a thought.
Okay. Ms. Bogart, did you want to contribute to the conversation?
I did have the information that was requested around the percent and statistics, and I apologize for not getting that to Anna, but we had pulled this data for another purpose on April 6th, which was less than 2 weeks ago. So that is, or just about 2 weeks ago. So that's the date that I have the data, but on April 6th, there were 451 deaths associated with long-term care and congregate care facilities. 441 of those, so just about all, were long-term care, such as nursing facilities. The others included shelters or jail facilities, other congregate care, but not necessarily long-term care. And that was across 83 different facilities. And 451 out of the total 746 deaths recorded on that day makes that 60.5% of all COVID related deaths.
Thank you. Senator Baldacci?
Yes, thank you, Mr. Chair. I think there are too many holes in this bill, because not only about the term essential caregiver, but I mean, there's nothing in here that doesn't prevent somebody from changing who the essential caregiver is every day. Plus, there's also the obvious public health threat. And I think that I understand the good intentions, and I totally sympathize with those family members. I have a father-in-law who's in long-term care, and it's been a struggle for our family for the last couple of years, but I think we gotta, I'm going to move ought not to pass.
I second that.
And I noticed we've been joined by Ms. Gallant. Did you have something to contribute to the conversation?
Well, I think just to note that there are new CMS guidelines that were issued March 10th, which really does open up visitation. And that there's been a lot of education that's been initiated by the department. The Ombudsman program is going to be doing a webinar with families on the 27th of April. That will be with CDC and with licensing. So I feel like some of the concerns of families will be addressed through these new guidelines. I know Bill Monteo is listening and certainly can give you much more detailed information, but I do think the new guidelines will make a significant difference. We are hearing from families about their concerns. We all know it's been really tough to be separated. There was a necessary time period because of the outbreaks that you're all aware of. However, I do think that the new guidelines are going to make a big difference in terms of access and visitation. And certainly Bill is able to answer questions about that.
Thank you. Representative Ziegler, you had your hand up. Do you have a particular question of either of these two?
Actually, thank you, Mr. Chair. It actually fits very well, because I was reading my notes and noted Director Montejo's testimony that Ms. Bogart read into the record, and so I would add, I guess, a question now. Given what Ms. Gallant just said, you had raised the concern that this law would contradict CMS guidance, which would threaten funding. Given we have a lot of concerns about lack of funding in our healthcare system here in Maine, do you think that concern still exists, given what Ms. Gallant just shared?
Yes, I mean, there are a couple of things with the bill, and while I think the intent is noble, I do think the revised guidance that came out on March 10th really addresses the heart of the issue, which is visitation, and really puts a lot of restrictions on when a facility can restrict visitation and when they must open. And we're, as Brenda alluded to, we're doing a lot of education with facilities to ensure that they're not arbitrarily closing to visitation. But the biggest issue, which Anna Brom kind of highlighted in the guidance that I sent for your review, is the phrase that in the CMS memorandum that they do not recognize essential caregivers, whether it's that term or not. They treat them as the equivalent of any other visitor, and facilities must allow for visitation. There's very clear, there are core principles that facilities have to follow. There's now, that came out on March 10th, very few exceptions for when they can restrict visitation. One of the biggest ones being an ongoing outbreak. And even then, if they have an outbreak in a facility, they can only restrict visitation to the specific unit that the outbreak is on, unless it's spreading throughout the facility. And even during an outbreak, they must allow for external visitation. The concern related to the funding piece and this bill is it requires the essential caregiver to have access even during a pandemic emergent situation. And you have in writing from CMS a statement saying, we don't recognize this. You treat an essential caregiver as any other visitor. And my concern is that this will put licensing in a predicament where we will go into a facility that is in complying with this law if it's passed and be out of compliance with federal regulations, and we'll be put in the position of essentially asking the provider, how do you want us to cite you? Under state law or under federal regulation, because you violated one or the other. There's no way you could be compliant with both in this particular case because of the language in the bill. But I do think, the heart of the issue here, since this March 10th revised guidance is being addressed, and we are actively providing guidance to facilities. We were with the Ombudsman and the Maine Healthcare Association going to have a webinar for families last week, but there were technical difficulties, and that's been rescheduled to next week to really highlight with families and provide clarification. So I think the heart of the issue has been addressed.
For those folks who aren't regular attendees, could you just briefly identify yourself and your role here?
Terribly sorry, Senator
That's
Claxton.
okay. I didn't ask.
My name's Bill Monteo. I'm the Director of the Division of Licensing and Certification within DHS.
Thank you. Senator Moore?
Yes, thank you, Senator Claxton. I just really want to make a comment. I appreciate the sponsor bringing this forward, but I think back or reflect back around December the 18th at cloture, it was a major issue and it was a major problem. And we had lots of very lonely people in nursing homes. But I think as Mr. Monteo said, I think we've addressed it and I think we're moving forward. I'm seeing a lot more contact. We're seeing lots of reunions going on. So I'm agreeing. I don't think this bill is necessary.
Thank you, Senator Moore. Are there other comments? I don't see any. Then there's a motion on the floor, ought not to pass. It's been seconded. Representative Zager.
I was gonna make the motion. I didn't realize it was already on the floor.
I have it as already being on the floor. It's okay. We'll count that as a second. All right. Any further discussion about this? The motion to be considered is ought not to pass. So Ms. Withy, if you could run the roll.
Representative Zager.
Yes.
Representative Zager. Yes. Representative Lemlin.
Yes.
Representative Lemlin. Yes. Representative Stover.
Yes.
Representative Stover. Yes. Senator Baldacci.
Yes.
Senator Baldacci. Yes. Representative Perry.
Yes.
Representative Perry. Yes. Representative Griffin.
Yes.
Representative Griffin. Yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven. Yes. Representative Madigan.
Yes.
Representative Madigan. Yes. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore. Yes. Representative Meyer.
Yes.
Representative Meyer. Yes. Senator Claxton.
Yes.
Senator Claxton. Yes. That's 11 yes, 2 absent.
Okay. That would move us to consideration of LD 1069.
Right, LD 1069. This is an act to provide program solvency, clarity, consistency, and flexibility in routine public health licensing activities. I am actually not going to read everything that's in the bill. This, for those of you that were on the committee last year, is a very similar bill to what you had last year. So some of it is around the specifics of eating establishments, lodging places, and so on, the things that are licensed by the department. It repeals the wild mushroom harvesting certification program that never really got off the ground. And then there are some sections that are related to electrologists, tattoo artists, micropigmentation, and body piercing, and making them all consistent with each other. Those things are in Title 32. So this is a health inspection program bill. It's very similar to LD 2063 and the 129th. It was unanimously reported out by the committee, but not reported out in time for adjournment last year. That included the compromise between the department and Hospitality Maine for lodging places to be 183 days in the aggregate per year, and then a permanent residence would be 183 days or more. And I just want to remind you that's about licensing. It's not about taxes. So other than that, which was in the last bill as well, the only differences that I could see was sections 4 and 6 of the bill, and section 14 of the bill was fines for operating without a license. That is new and differently organized. And section 16 is new, and you heard about that during the public hearing, that the agriculture department can detain or embargo food, but the Department of Health and Human Services can't. These are new terms to me, adulterated food. I had to go look it up. I don't know if there's a need to clarify that those rules are routine technical, but they are presumably routine technical, as is the rest of their rulemaking authority in this chapter. And I just, for your, maybe I wasn't the only person who didn't know what adulterated food meant, the following chapter in the statutes is this section around adulterated and misbranded. So this is the definitions that the department are looking at. You did hear about LD 681 in the Judiciary Committee related to rooming houses. My understanding about that bill is, and you should get this from the department, not from me, but my understanding is the issue of the 183 days issue has been resolved. The reason the bill is still tabled in the Judiciary Committee is related to evictions and things that are not a part of this bill. The OFPR preliminary fiscal impact statement is the same as last year's, which is that the department will require an ongoing other special revenue allocation of $40,000 annually, beginning in fiscal year 21-22 for any expected increases in revenue from increasing municipal licensing fees from 60 to 100, when they get to that. It's not that they're increasing all the fees from 60 to 100, it's because there's a conflict between the law with $60 and $100 in some other places. So and there was also one answer from the department. You had a question about, what happens if an establishment has both kinds of rooms? Some rooms fall under the less than 183 days, and some are more than 183 days. And the answer was, and this is in Molly's memo, that an establishment can be licensed for short-term lodging. Rooms that are let out for long-term are excluded from the license. Within the establishment, the health inspection program would only license those rooms that have guests for less than 183 days. So you could have a facility that has both kinds of rooms, and they would only license part of it.
Did anybody else find this very confusing about rooming houses and lodging facilities and licensing? And okay, so it's not just me. I see some head nodding. I needed a chart with different bullet points under each category. And this licensing challenge for us is relatively new. Before we go to Ms. Bogart, Representative Perry, you had a comment?
Yes, I was just reading through the department's testimony on that. And the impression I got is this cleans up and allows them to be more equitable in their licensing process.
Yes, Senator Representative Zager.
Thank you, Mr. Chair. I guess I have a technical question, and Ms. Broom might know the answer. Is that 183 days, is that like the average or the mean or the median of all the borders, or is that like if any one border goes above 183 days?
Are you asking me about who it applies to, or the 183 specifically?
Yeah, like is it clear enough, or in the way it's drafted, and what is exactly does it say? What exactly does it mean in that?
I mean, the 183 days is like for half a year, right, Molly? Isn't that what the 183 refers to? And so there was a discussion about, because this is about who the department license and what they license them as. So are they being licensed as a lodging house, I guess is what it is, the lodging establishment. And if it's, and what you wouldn't license because it's actually a permanent residence. And so that's where the department came down with an agreement. I mean, originally when this bill came out last year, it was like 90 days, right, Molly? I think it was 90, but there was a big to-do about that. So the 183 days was the agreement between the department and the hospitality folks about what would be licensed as a lodging establishment and what they would not license as a lodging establishment.
So if any one person who's staying there is there on the 184th day, the whole thing, the whole establishment.
That room, I believe, is the case. That if there's an establishment that has different kinds of lengths of stay, so to speak, it's weird to follow Molly like round to the Xbox up there at the beginning. But my understanding is that, and you can tell me if I'm wrong here, Molly, that the rooms that are 183 days, or maybe it's less than 183 days, then that room would be considered or licensed as a lodging establishment, right, Molly? And if it was more than that, it would not.
Yeah, and Lisa Silva, who's the director of the health inspection program, is here and can certainly get more into the specificities than I can. But that's correct.
It's not that this is new either, right? It's just the length of time that's different, Representative Zager. So it's not like you didn't have this like strict situation where you've got some rooms and licensed and by the department and other rooms not. It's just the 183 days that's being clarified.
Yes, and the 183 days is the same that this committee approved last year.
Right, and that distinguishes between the hospitality industry and the long-term stay industry, whatever we want to call that. I don't want to use any of the words inaccurately. Maybe Ms. Silva can help. Welcome.
Sure, thank you, Senator Claxton. Molly and Anna are correct. The 183 days actually came, it was a point brought up by our Hospitality Maine folks that in statute already existing, the tax laws state what a domicile is. So a Maine resident, if they're here more than 183 days, they are a permanent resident of Maine. And so we figured that since this is already in law, and this is really a good defining line as to what is a short-term stay and what is a long-term stay. We've been struggling with this since I came to the program since 2005. So we tried in 2011, 2013 to clarify this lodging place definition, and we failed. And we failed because we did not have a that line, so to speak, as to what is a short term, what's the definition of short term? People kept asking, how many days is that? And we didn't have the answer until this lodging definition that we worked on with Hospitality Maine and the Maine Campgrounders Association, both our stakeholders. And, you know, I thought it was very consistent. You know, it's already existing in statute. And then the other point in the definition to make is that we are saying these lodging places are for tourism, recreation, the hospitality industry, not rooming houses, not permanent residences. That's not what we license. If you look at our license types, we license restaurants, takeouts, mobile food vendors for, like fairs and festivals, campgrounds, youth camps, hotel, B&B, motel, and public pools and spas. They all have one thing in common. They're recreational tourism industry.
Okay, so this allows the department a clearer definition of the places that they're going to license, as opposed to the ones where they have no role in licensing at all.
Correct. This will provide guidance for our inspectors, a clear line on what meets our licensing definition, because we do not want to overregulate. So that, and it's been a problem because we haven't had that clear line. So we have erroneously licensed some rooming houses that we should not have, and we're trying to rectify that.
And the question was asked earlier was, what happens to some, in the circumstance that somebody who comes to a hospitality facility and stays 184 days? Should that, does that room now get licensed?
That
No,
room,
does that get unlicensed?
that room would be unlicensed, right?
Yeah.
But not the whole establishment. If the whole establishment wanted to run a rooming house or rooms over 184 days, then we would not license the entire establishment, but we would work with the owner on that. They would need to tell us which rooms are long-term and which rooms are short-term. And we would only license the short-term rooms.
And the circumstance in which I've seen this most often applied is in what used to be a former hotel, where people basically take up residence and the hotel becomes, it leaves the hospitality industry and joins the rooming industry.
Correct.
Okay, becomes a rooming house and it's no longer licensed.
Well, that may be some of what we're currently licensing. They've morphed.
Right.
Correct.
But you'd like to get out of that business.
Correct. We were never supposed to be in that business.
Understood. Okay. All right. So does that help answer some of the questions? All right. Well, I appreciate that. And I did spend significant time with the back and forth between you and Senator Libby's office, Senator Libby. And I think there were a good deal of his concerns were addressed. I'm not sure all were addressed to his satisfaction, but that's a different issue and he's not here and I can't speak for him. So any other questions or clarifications we need from folks who know what they're talking about related to this licensing and the distinction between rooming and hospitality? I'm not seeing any. Based on that, Representative Meyer? I'm still not hearing you.
Sorry about that.
You must be new here.
Thank you, Mr. Chair. I would move that LD 1069 ought to pass.
Second.
So there's been a motion ought to pass and a second. Are there additional?
That's a fiscal note only. So it's actually technically ought to pass as amended.
As amended.
Okay, thank you. And are there any questions, discussions about this? I don't see any, so we can go to Ms. Withy for count of the vote.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lumlin.
Yes.
Representative Lumlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 11 yes, 2 absent.
So hopefully this will allow the department to resolve, or the division to resolve, some of the confusions. And it sounds like from my reading that at least part of the work now will be to help to educate the folks who have been licensed inappropriately with respect to this bill, understand what their options are in the circumstance of somebody who should no longer be in the facility, because that was one of the issues that got raised. Okay, good.
We'll do that.
Let's hope that plays out that way. Thank you.
Thank you.
All right. That brings us to consideration of LD 1234.
Right. I am just glad, Lisa, that we sorted out all the weird things that were in that bill last year, because could you imagine trying to explain all those strange things that came out in the drafting over Zoom? I can't even imagine.
Thanks for your
All
help.
right. Oh my gosh. Okay.
Thanks
So
for being
LD 1234, an act to allow lemonade stands and other food and non-alcoholic beverage sales by minors. This bill prohibits the department, the state tax assessor, and municipalities from requiring a license or a permit or charging fees or sales tax for the operation of a stand on private property operated by a person under 18 years of age for the occasional sale of prepackaged food, baked goods, lemonade, or other non-alcoholic beverages. You heard from the sponsor that this is part of a country time thing. The department, DAFs, this is the tax folks, said a tax exemption is not necessary as a casual sale is already defined in Maine law and not subject to sales tax. And I did put that language at the bottom of this. And the Maine Municipal Association is unaware of any municipalities that are licensing or permitting lemonade stands. So there is a possible unintended consequence here. If you were to enact this, it's possible that you could have an establishment that should be licensed that claims to be a lemonade stand. That's always the fear when you do something like this. I don't know what occasional sale means, or why prepackaged food might be included, since this is about lemonade. And then I won't go back to the DAF thing because you've already heard about that. You did ask for the requirements for individuals over 18 years operating a stand on private property. So the current law, and this is the same section that you've just been looking at, requires a license to run the things that you heard about in the last bill. But it includes it includes a mobile truck, where am I up to? I'm sorry, I lost my plot here. Any person, regardless of age, that plans to prepare, serve, or sell food from a stand on private property is required to obtain an any place takeout license, but the state has never licensed lemonade stands on private property that are operated by minors. All eating establishments, including mobile vendors, must meet the requirements of the Maine Food Code, which you did receive in your email, and also farm stands are under the Department of Agriculture, Conservation and Forestry. So DHHS do the mobile trucks, and agriculture does the farm stands. We haven't yet received it from we haven't yet received the preliminary fiscal impact statement from OFPR, but I did put the casual sale in here if you were interested in looking at that.
Does that analysis raise any questions or comments from the committee to begin with? Representative Craven.
Thank you, Mr. Chair. So it would seem to me that since that that we don't tax or license or otherwise oversee lemonade stands, especially lemonade stands that minors operate, that this is a bill that we don't need, and so I would move not to.
Before we move any further, I want to make sure that we have a chance to hear from the sponsor. Welcome, Representative Fecteau. Did you hear that analysis and have any concerns, questions?
I did hear the analysis. Thank you, Mr. Chair. You know, it's always great that the casual sale isn't taxed or whatnot. But I did just see the analysis that regardless of age, and it was really quick and it was kind of blurry as I was going back and forth, expanding the screen. But regardless of age, would have to get a license to sell food, at least in that one circumstance that the analyst did pull up. So I just don't think it's extremely clear that minors can sell lemonade in a sort of fashion that wouldn't include possible enforcement.
And my understanding from the analysis is that the Maine Municipal Association isn't at all interested in regulating lemonade stands, and neither is the state public health inspector. Did I get that right, Anna, from your analysis?
Yes, but I don't want to mischaracterize the Maine Municipal Association. They didn't oppose the bill. They just said that they didn't currently license or permit lemonade stands. I don't want to mischaracterize their testimony.
Okay, thank you for that clarification. All right, other questions or concerns? So there's, yes, Representative Meyer.
Thank you, Mr. Chair. I would second Representative Craven's motion.
So the motion on the floor is ought not to pass. It's been seconded. Are there additional questions, considerations, discussions? Senator Baldacci?
I would just point out for the record that the Maine Municipal Association actually filed a letter in support of this bill. So I understand the communications, but they did file a letter in support. Just, I think that should be clarified based on what's been said previously.
Okay. Thank you for that clarification. Yes, Representative Zager.
Thank you, Mr. Chair. So if I understand correctly, lemonade stands are not prohibited now. They're not taxed. They're not listed as a crime, and they're not permitted or require any sort of license. Are all those the elements of something that would qualify as a prohibition of something? In other words, I guess my question is it true that they're not prohibited now?
I think what you're asking is do you need to specifically prohibit permitting in order to mean that they make a lemonade stand legal? I think that's what you're asking. And the law is not requiring a permit, and nobody is, there's no state department that is requiring a permit. So what I'm trying to say is that because you're not specifically allowing a lemonade stand, its absence doesn't mean that it's not legal. Like it is legal to have a lemonade stand. You don't have to write it into the statute to say you can only do this if we write it in the statute that says it's legal.
So if a kid grew pumpkins in the backyard and wanted to sell some in the neighborhood from the front yard, because there's no law against that, doesn't mean that it's not legal. It means that it's legal and there's no law related to it.
I don't know about pumpkin stands, to be honest with you. What I mean is, there are like farm stand laws, and I don't know what those are. I mean, I don't want to step out of what I know here.
Touche. Okay, I stand corrected. That's why I'm not in your job, because, all right.
Well, I think we'd need to be in a different committee. You would need a different analyst to tell you about farm stands.
It was a bad analogy. All right. All right, I won't try and clear up any more confusion. All right, are there any other comments or questions or concerns before we vote on an ought not to pass motion? Okay, Ms. Withy, can you run the vote?
Representative Zager,
Yes.
Representative Zager, yes. Representative Lumlin,
Yes.
Representative Lumlin, yes. Representative Stover,
Yes.
Representative Stover, yes. Senator Baldacci,
No.
Senator Baldacci, no. Representative Perry,
Yes.
Representative Perry, yes. Representative Griffin,
Yes.
Representative Griffin, yes. Representative Connor, Representative Connor is absent. Representative Craven,
Yes.
Representative Craven, yes. Representative Madigan,
Yes.
Representative Madigan, yes. Representative Javner, Representative Javner is absent. Senator Moore,
Yes.
Senator Moore, yes. Representative Meyer,
Yes.
Representative Meyer, yes. Senator Claxton,
Yes.
Senator Claxton, yes. That's 10 yes, 1 no, 2 absent.
Senator Baldacci, do you have a minority report?
Just ought to pass.
Thank you. So thank you, Representative Fecto. I know a lot more about lemonade stands and licensing and permitting than I did before. So it serves.
So do I.
I'll bet you do. It served to educate the committee. That by itself is worth something. So thank you. All right. So that allows us to move to consideration of LD 1241.
Okay, an act to establish more transparency, due process, education and understanding between DHHS and certain main businesses. This bill requires the department to establish a standard procedure for investigating complaints against establishments licensed under the same section that we've been talking about for the last two bills. The bill provides that certain information must be shared with the owner or person in charge of the establishment that is the subject of such an investigation, including the name of the complainant, the name of the department employee investigating the complaint, the laws, rules, executive orders, or policies not being complied with, a corrective action plan, possible accommodations as alternatives to requirement and the appeals procedures. The department is required to issue a finding with respect to compliance. The bill also requires any scientific or educational materials that are unrelated to licensing requirements to be clearly identified as scientific or educational materials as opposed to licensing requirements. If a representative of the department visits an establishment to discuss these materials, advance notice must be provided and the visit must take place in ordinary business hours. Municipalities that are delegated authority of licensing and inspection by the department are subject to the same requirements. And that last line is just the reminder of which sorts of establishments we are talking about. So the sponsor and co-sponsors were looking for a standard operating procedure for businesses, concerns about false accusations, rights to appeals, and being able to face their accusers. And they are distributed by the complaint portal. The CDC stated that they already have standard operating procedures when complaints are observed. I lost my memo. When complaints are observed, they try to use education first to meet requirements. The health inspection program usually responds to around 500 complaints a year. In 2020, that was considerably more, and there is no way to know which are legitimate, so they have to respond to all of them, but complaints have to be validated by the program. The law requires the health inspection program not to announce inspection visits, and the public need to retain the ability to complain anonymously. So those were the objections from the department. The conflicts is just the conflict about, I'm going to go back up again. This is the conflict is about the announcing inspection visits. So that's just what that reminder is, that if you would need to sort that one out. It's unclear how scientific and educational materials that are not required for licensing would be relevant for complaints. And then there's just a little bit of a circular problem here that could be sorted out if you are moving forward. Subsection 4 requires a completion of complaints pursuant to subsection 3, but the confirmation of corrective actions is in subsection 3. So there's a sort of a circular problem there in terms of the timing that would need to be sorted out. You requested standard operating procedures for the department to follow up on complaints about eating establishments or other licensed facilities in that chapter. The health inspection data for 2020 was Lisa gave during the public hearing. And this was the receiving more than 4,000 complaints. The health inspection program followed up on 1,700 in the municipalities on 2,400, and the number of fines and suspensions and imminent health hazards. But that generated the question of the 2019 data for comparison. And I had that memo sitting on my desk, but I've suddenly lost it. You also asked about bills in the Judiciary Committee, and that bill LD 725 is an act to improve transparency in state code and license violations by making public the names of complainants. The bill required the name of any person filing a complaint alleging a violation of an order, code, license, or other requirement to be made public upon request. My understanding is that bill has not been reported out of Judiciary Committee, but it was voted on a straight party line with the majority voting or not to pass. Preliminary fiscal impact statement is a minor cost increase to the general fund, and any additional costs to DHHS to adopt the changes in this bill are expected to be minor and can be absorbed within existing budgeted resources. And that's just the section that Lisa pointed out conflicts with the right of entry that you would not need to straighten out. And I'm going to try and find where the heck my other memo went. Oh, here it is.
So while she's looking for that, has this raised any questions? None so far. We'll come back to that.
So this is the standard operating procedure. You received those two attachments in the email that Molly sent yesterday afternoon. And there is the 2019 complaints data that you asked for the comparison with 2020. Can I stop sharing that, or do you still need it up?
Let's stop sharing and see what happens.
Okay.
Does that prompt questions or comments from the committee? Any concerns, follow up? I'm not seeing any. Representative Fecto, any thoughts after hearing the analysis that we should have?
Yes, Mr. Chair. I knew that we were going to find a few snags within how the legislation was crafted. I guess and I kind of alluded to it in my testimony about the visitation issue. I think some of it got lost in translation, and I just kind of brought it to the committee. This was not, I understand the need for surprise inspections. I do. I was talking about when during the education portion, when the department would go and just speak to a business owner, that would be handled in a mutually agreeable way, and not to get rid of the need for a surprise inspection. And so I think some of that was lost in translation. At least that was my intent. And I kind of alluded to that during my public testimony. In dealing with various numbers of constituents, and then people also outside of my district as well, the standard of dealing with the department during this last year has not been standard at all. It's been very difficult for businesses to understand what their rights are, what the next steps are, what the consequences are. And a lot of deal making would happen over the phone and on the internet. And that's just not really a productive way on how people businesses, corporations should be interacting with government. We don't do that in schools. We don't do that in courts. We don't do that with the police, you know, and at other non-type of law enforcement ways. So I do think there's some room here for some growth and some standardization. Not to say that they don't have standard operating procedures, because that would be an absolute lie. There are some standard operating procedures, but I think it's a fair assumption that we should be able, as business owners, and you know, in America, facing your accuser is a kind of an American tradition, and I don't think that businesses were given that have been given that opportunity, as well as to clearly see the list of corrective actions, timelines, and consequences, and then the rights to appeal when things were false. And if the department is even unaware of I understand that false accusations, they're not sitting there with a magic 8 ball or anything like that, but to not even know if the people are real or have no sort of recourse for false accusations, not necessarily within the department, but any sort of false accusations. If there's, and then these complaints can just keep coming in. One business within my district was receiving complaints on a day they weren't even open. And I've been informed by several other businesses in my area that they have received false complaints. So I do think there's some room for growth here. And so I leave that to the committee to work on that. Thank you.
Thank you. Representative Lemelin?
I think Senator Baldacci was ahead of me. If he'd like to go, Senator.
Thank you. Senator Baldacci?
Oh, thank you. I was going to make a motion to table. And the reason for the motion to table is because I think that the goals that Representative Fecto is talking about are perfectly legitimate, and I think in some sense it would remove kind of an arbitrariness in some of the, or at least perceived enforcement. But the move to table it, because I think I'd like to see, there must be some people in the AG's office that could review and comment on this. I'd like to get their take on this because they also do the enforcement. If this has to go to court. So before we act on it, I'd like to at least get a briefing from our state's lawyers, because ultimately they're the ones that are going to have to implement it. So what they see as issues, I think that will make our discussion a lot more constructive and informative. So I make a motion to table.
Is there a second for that tabling motion?
I'll second it.
Okay, so unfortunately, Representative Lemelin, we have to vote on the tabling motion before we hear from you, but we'll come back. So let's do a show of hands. All those who, well, no, let's have it run the list. Would you, Ms. Withy, on this tabling motion for LD 1241?
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover. Representative Stover is absent. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So
I'm
that
sorry, I need a little more clarification on what I'm asking the AG's office to do, please, Senator Baldacci.
that's where I was going.
Well, I think they have a division regarding licensing that handles administrative and law enforcement. So I would ask the director of that division to, if he could, he or she could review the document, give us their comments, pro, con, or, you know, because they're doing the enforcement. So ultimately,
Are you talking about the bill or the current standard operating procedures? What are you asking me to review?
I'm talking about the bill. I'd have them review the bill and give us their comments, pro and con, from the standpoint of the people who are have to take these cases to court to enforce them. So I think they have probably a wealth of knowledge on these issues. And I understand there's the state's attorneys, but I think they still have a wealth of knowledge in terms of these issues. They could help us pro and con in terms of how the bill is set up and what it would require us to do and whether it's feasible or not. Thank you.
Is that enough clarity, Anna?
I shall consult with my counsel as well. In other words, Erin. I'll ask Erin as well. Yes.
All right. Representative Lemlin, you had your hands up. Was it related to this bill 1241, which we just tabled?
Yes, it is, Senator. My concern was, I think I'm misunderstanding something. Representative Fecto, it sounds like he's trying to get a bill to allow the businesses an opportunity to defend themselves. But when I read the bill, it almost seems like the opposite is happening. And what this bill is doing is like a big brother thing. It allows the department more opportunity to harass businesses if somebody makes a complaint that somebody may not have been following the rules.
Yeah, at this point with the bill on the table, I'll have you hold that thought until it comes back to work session. And maybe we can get some clarity from the query to the AG's office that might address what sounds to you to be different goals than was intended by the representative. So Representative Fecto, you heard what the plan is. We'll see what the AG's office thinks, and we'll schedule another work session and have some more conversation.
That sounds great. As a member of the Appropriations Committee, I'm in awe of the work that you have to do. So thank you to the committee.
Thank you, sir. All right. So that'll allow us to move to LD 1252.
The last one. All right, an act to improve family daycare providers by increasing the number of children allowed to be cared for without obtaining certification. This bill increases from 2 to 3 the number of children a family care provider may care for in the provider's home, not including the provider's children, before the provider is required to be certified as a family care provider. The bill also specifies that the sibling of one of the children under the care of a provider, not a child of the provider, does not count towards the limit of 3. And these provisions were in the governor's executive order, and this would make them permanent. You heard proponents, accessibility and affordability are problems for childcare, and they'd like less regulation. Opponents require licenses and certifications for all sorts of professions, that no oversight of unregulated childcare unless receiving a subsidy. And we should be continuing to support efforts to increase family care providers and focus on workforce development. And the department supported the executive order, but not making it permanent. They can't track unlicensed providers, and consumers may not always recognize the oversight differences between licensed and unlicensed. That's just a reminder that the LD 98, which has been enacted, amended these sections of law to reflect the changes from certification to licensing. In other words, if you wanted to move forward with this, we'd need to make those clarifications because we now use the term licensing, but that's not difficult at all. It's a little unclear to me the way that the fourth child sibling exception isn't included in the definition as part of who is not a family care provider. It goes ahead and makes a sort of notwithstanding, which I think is kind of peculiar. It would seem to me that if you want to say what is not a family care provider, then you would just do that, but that's also a technical issue. You requested some additional information. First of all, you asked if there was any information on complaints to the department about childcare providers licensed and unlicensed, and what they do if there are complaints about unlicensed childcare providers. Also, whether an unlicensed childcare provider can receive subsidy. So this is just a direct, I just pasted it right in. If the department receives a complaint regarding an unlicensed provider, the first response is to investigate whether they are providing care for a number of children that exceeds the statutory limit and thus operating illegally. If they are operating illegally, children's licensing works with the provider to become licensed, cease operations, or reduce to the number of children to comply with the limit. For unlicensed providers who are operating within the statutory limit on the number of children, children's licensing has no jurisdiction to investigate a complaint, as there is no oversight or regulation over those unlicensed providers. OCFS has no means to track unlicensed providers who are operating in the state, as they are not required to be licensed or otherwise register with the state. And there are a small number of unlicensed providers who receive subsidy through the childcare subsidy program. And through CCSP, they receive an annual health and safety inspection as a licensed exempt provider. I was also asked for the requirements in other states, and you got that in a different document, which I can pull up if you'd like. But I did send it to you so that you could look at it, because it is rather a long thing that our researcher put together. And I do have to tell you, Senator Moore, is she still here? That our researcher I forwarded her your thanks, and she was very grateful.
All right. Does that raise questions from that analysis? I don't see any. Any concerns or any questions to be addressed to Molly for clarification, or to Anna? Still don't see any. So at this point, I guess we'll entertain a motion. Representative Meyer. You're still on mute.
Boy, oh boy. I would move that LD 1252 ought not to pass.
I second that.
So there's been moved and seconded. Is there discussion about that motion? Yes, Representative Griffin.
Sorry. I'm going to vote ought to pass because I think people should be able to have who they want in their house. And there shouldn't be any, because it's really just up to, I think it's just adding two more. And if you look at other states, some are up to 4, some are up to 6, up to 5. I just think too much government oversight isn't good, and people should be able to watch kids in their home up to that certain amount, because the governor did do it during the emergency mandate, and I think I don't see any reason why it shouldn't stay the same. Thank you.
Okay, thank you. Senator Baldacci?
I think today that Representative Griffin and I are kind of communicating on the same wavelength. I looked at the data that was provided to us yesterday about the other states, and I'm somebody. I agree, in terms of some of the issues that Representative Griffin had mentioned. I think that increasing it from 2 to 3 is not a big increase. It's not going to threaten any existing structures or safety. I think it's a very small accommodation, and I will be voting in favor of the bill. So I just want to let people know my reasons. Thank you.
Very good. Thank you. Representative Craven?
Thank you, Mr. Chair. I think that the department for years have been working diligently to make sure that we have excellent educational daycare providers that give our kids a head start, and especially children from low-income families who may be tempted to place their children in unlicensed homes instead of going to Head Start or other organizations that are set up not just to help the child, but really to help the family and to instill lifelong improvements in their educational attainments. And so it's not that I don't support independent providers or community daycares, but we really should be supporting the department's efforts as opposed to sidelining the efforts. Thank you.
Thank you. Representative Perry?
Yes, I was just having memories of a very, very long time that we went through in terms of getting a lot of the rules that we have in place together with a lot of input from all caregivers. And it was with a great deal of work and study that these rules were put together in, I think it was 2 or 3 years ago, maybe 4 years ago. But it was, it took a lot of work, and I think that we've got to let that stay.
Thank you. Any other comments, concerns, questions? Yes, Representative Meyer?
Thank you, Mr. Chair. I would echo Representatives Craven and Perry. We're all fully aware that we need more quality childcare providers in this state, that it's an issue. But we've worked too hard, the department has worked too hard to lower the bar now. Our kids deserve high quality childcare, and for that reason, I would ask our committee to follow me on ought not to pass.
Thank you. Any other comments? Seeing none, we'll ask Ms. Swithy to run the vote. The motion on the floor is ought not to pass.
Representative Zager?
Yes.
Representative Zager? Yes. Representative Lemlin?
No.
Representative Lemlin? No. Representative Stover? Representative Stover is absent. Senator Baldacci?
No.
Senator Baldacci? No. Representative Perry?
Yes.
Representative Perry? Yes. Representative Griffin?
No.
Representative Griffin? No. Representative Connor? Representative Connor is absent. Representative Craven?
Yes.
Representative Craven? Yes. Representative Madigan? Representative Madigan is absent. Representative Javner? Representative Javner is absent. Senator Moore?
No.
Senator Moore? No. Representative Meyer?
Yes.
Representative Meyer? Yes. Senator Claxton?
Yes.
Senator Claxton? Yes. I see that Representative Stover has joined us. Were you able to hear the bill?
I
And
can hear a repeat of the motion.
The motion on the floor is ought not to pass. It's related to 1252.
I will vote yes.
Representative Stover? Yes. That's 6 yes, 4 no, 3 absent.
Thank you. So that's it on the list of bills that we were to consider today. I want to make sure before we quit that Senator Baldacci has a chance to register his votes for any that he missed.
I'm sorry, before you do that, can we have the minority report on that bill?
I'm sorry.
Because first of all, there are some technical amendments that you need to make. So you may want to take care of that. And I want to make sure that you're all on exactly the same page, that you want both pieces, which is from 2 to 3 children plus the sibling, whether you'd like me to fix the drafting on that and also the certification licensing issue.
I'm fine with that, and also the technical amendments that need to be made, but.
Okay, so they're all technical amendments. That's what I needed to know. Thank you.
So everybody's okay with that approach? All right. Good. All right. My bad. So I think that takes care of today's list of bills. And like I started to say before I jumped ahead of the script, was that we need a chance to record Senator Baldacci's vote. So I think when we get done with that, then we will be reconvening tomorrow at 9 o'clock for public hearing on 5 bills. That would be at 9. So do you want to record? Yes, Representative Zager.
Thank you, Mr. Chair. I just wanted to just confirm what's the order of those bills tomorrow morning?
Do you have a request?
I do have a request. I have a request that 1333 be first at 9 o'clock.
And whose bill is that?
That's mine. And
I knew that.
Senator Claxton, Representative Zager is the only person who has made that request, and he made that several days ago.
Yeah, no, I know. It's already there in my book. So we'll start with 1333 in the morning and then go the way they're published. 789, then 1177, and then 1428 and 1487. So yes.
I appreciate the indulgence of the chairs.
You can have the 9 o'clock slot. Yes.
I have 2 quick things. One is I think that you have all caught up with I'm just going to share my screen for a minute for a reminder here. If I can manage to bring up the right screen, it is this one, I believe. This is LD 783, which was a vote that you had ought to pass. You apparently need to reconsider it. There was one of the people who were not present at the work session voted incorrectly, and everybody acknowledged that it was just a mistake, but the presiding officers require you to revote it, to reconsider and revote it. This was a straight ought to pass. So if you would have a moment or two to do that right now, that would be helpful to everybody. It was a unanimous ought to pass. There's no opposition, there's no amendment. It was purely an error on the part of the person who wasn't present. So if you would be willing to do that, that would be helpful. And the other thing is I have one amendment for you.
So this is the Sexual Assault Advisory Board that we made some changes on in terms of where one of the nurses came from, no longer from the state nursing board, which never supplied one, but now in front of the school. Were there other changes?
No, there were no changes made by the committee to the bill, and there's no fiscal note. So it is literally a straight ought to pass. You just have to revote it so that it can be straightened out in the POs.
So I would entertain a motion to reconsider 783.
Oh, I'm sorry, you can't see.
What?
Okay. I had the screen.
Oh yeah. Yes, Representative Craven.
Thank you, Mr. Chair. Having voted on the prevailing side, I move that we reopen the 789.
Reconsider LD 783.
Reconsider 783. Thank you.
And Representative Perry. Is that a second? Okay, and just for the record, I did know that we voted unanimously. We are all on the voting side. of the majority voting side. All right, so this is a chance to vote again, and we'll turn it over to Ms. Withy to run the vote. The motion on the floor is ought to pass.
Representative Zager.
Yes.
Wait a minute.
Ought to pass as amended, I think.
Was there? No.
No. Okay.
No, and right now you have a motion on the floor to reconsider. You don't actually have a motion on the floor to vote to pass, but no, there is no amendment.
Okay, so right now we're voting on the motion to reconsider. Thank you. So, Ms. Withy?
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes.
So that's unanimous of those present, which is a total of
11 yes, 2 absent.
okay.
Mr. Chairman, I would make a motion ought to pass.
On LD 783, is there a second?
A second.
Okay, so the motion's been moved and seconded on LD 783 that it ought to pass. You're up again, Ms. Withy.
Representative Zager.
Yes.
Representative Zager, yes. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yeah.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan is absent. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent. And I would just add a correction that the vote to reconsider was 10 yes, 3 absent as well.
Right. Okay. Thank you. All right.
And I
you had
have
one
one
other thing?
amendment. I
Okay.
have one amendment to show you. It is a fiscal note only. It is of no surprise to anybody. This is the chiropractor bill 376. This is exactly the same as the fiscal note that you had at the work session. So it comes as no surprise to you, but and you just need to see it. Usually I would, if there were a substantive change, I would have sent out a notice and you wouldn't have been surprised by this. But I got it late last night and there's no changes to it. So I just wanted to make sure that you could see it so that it could go forth and be put together and reported out and so on. So that's all. That was the last thing I wanted to show you.
Anybody who's not okay with proceeding with that fiscal note, please indicate. Not seeing any, I think that concludes the consideration of that. So thank you for bringing that up. The only remaining step now is to get Senator Baldacci a chance to register his votes. I don't think that requires all of us to stick around. It does require, I think, the chairs to make sure that we see the voting process. So that's your call. You're welcome to stay if you'd like. Which votes do you need to? Yes, Representative Stover.
I had to hop over to judiciary a couple times today. Did I miss any votes? I missed one early, I think.
Yes, you did. And if you're in line, if you'd like to stick around, you can get your vote recorded
I'd like
too.
to stick around. Thank you.
Okay. So which votes are missing for Senator Baldacci?
Senator Claxton, should I just go through the,
One at a
I think-
time, if you would.
okay,
Yeah.
great. LD 74, the motion was ought to pass as amended. And the vote currently stands at 9 yes, 4 absent.
So I would go with the prevailing side.
Senator Baldacci, I'll put you down as yes.
Yes.
Okay. Let's see. Oh, I was just about to say Representative Lumlin. Oh, wait, never mind. He wasn't absent on that one.
Did I miss any others?
I believe so. Let me just go through.
She's going through the sheets now, the tallies.
There were a lot of them today.
Yeah.
That might be it for you. Representative
What about
Stover.
What about 118?
That would have been the second one we considered.
Yeah, that would have been right after 74.
I have your vote for that one.
Okay, so I'm all set.
Yeah, I thought you missed more than that as well. But I guess, let me just check the last few. Okay, that's it.
Okay, thank you.
Okay, you're welcome.
Chairman. Thank you.
Thank you, Senator. Representative Stover, if you want to unmute yourself, you can do your voting.
I believe LD 74, correct, Ms. Whitney?
Well, got to go back to the top of the pile. Hang on a minute.
I think the only vote you missed was actually 1241, and the vote was to table.
Oh, okay. So you don't need a vote.
No, I mean, I can put you down as yes.
Yes to table.
It was unanimous tabling motion. So.
And let me just check that there's nothing else though.
Not 74?
Nope, I have you here for 74. Let me just go back through the list and check all the other ones.
I think I was just late. That's all.
You are all set.
Thank you. Have a nice